SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts Programming. Good, useful, and full of wonder. SDPB.
Okay, good morning. We'll call Senate Health and Human Services Committee meeting to order. I want to welcome everybody in the room and all those that are listening online and those that may be watching on the streaming service. I'll remind everybody, please turn your cell phones to silent so we don't disrupt the meeting. And with that, I'll ask the secretary to call the roll.
Senator Grove.
Here.
Perry.
Here.
Reed.
Here.
Smith, excused. Voigt.
Here.
Davis, excused. Jensen.
Here.
Mr. Chair, we have a quorum.
Okay, thank you. I guess I'd entertain a motion to approve the minutes from the previous meeting.
So moved.
Senator Reed moves to approve the minutes from the previous meeting, seconded by Senator Grove. All those in favor say aye. Opposed, nay. Good, the minutes are approved. A reminder to testifiers, if you're here testifying on your own behalf, please sign in on the iPad up here, or you can use the QR code. That way your name goes permanently into the register. Lobbyists, of course, have your proper credentials. If you haven't testified before, when you come up to the microphone, push the button. Once it turns green, you introduce yourself and begin your testimony. And I know we'll have some remote testimony today, too. With that, I guess I'd like to have the pages come up and introduce themselves. Your name, where you're from, and future plans.
Hi everyone, I'm Olivia Moffett from Hot Springs. I'm a junior and I plan on going to Southern New Hampshire University, and I will be graduating high school early. So I'll be going to Southern New Hampshire University next semester, going through a business degree and then going into law school afterwards.
Hi, my name is Poppy Stevens. I'm from Rapid City Central. I'm a junior, so I don't really know where I plan to go to college yet, but I do plan to major in nursing and minor in music.
Okay, good, thank you. And as a reminder, too, if you have any handouts for the committee, please give those to the pages to distribute. I think with that, we have 5 bills we're going to try and get through here, so we're going to get started right away. We'll start with House Bill 1006, create a task force to study the creation of Indian medical managed care entities in the state. Do we have any proponent testimony? Good morning.
Good morning, Senate Health and Human Services. My name is Tamara Grove. I'm with District 26. I come to you today as a member of the State Tribal Relations Committee, along with one other member this morning. I also come as a request of our tribal community statewide, asking you to take the first step and what I truly believe could be the most significant change in the state law as it pertains to our tribal communities in this century. I'm talking about exploring an Indian managed care model for Medicaid. This is an option that the state, along with our tribal partners, can choose to enter into, like the Cherokee tribe in North Carolina, Oregon, Wisconsin, Washington, Arizona, and New Mexico. And Indian managed care entities are not experimental. They are explicitly authorized under federal Medicaid statute. I want to emphasize something. This is not only an incredible way to manage American Indian healthcare, but this is also a sovereignty issue, a treaty issue. This is exercising self-governance through an Indian managed care entity. Historically, Native people may interact differently with Medicaid managed care programs than Medicaid enrollees who are not members of a tribe. Federal managed care protections limit the ability of states to require that Native people enroll in state managed care programs. So many of our tribal members enrolled in Medicaid receive services through a fee-for-service delivery system. For tribal members who are enrolled in Medicaid managed care, these entities may not always be adept at meeting legally managed, mandated managed care protections, which can lead to limited access of care or a lack of culturally relevant services. Additionally, tribal leaders may feel that requirements to work closely with the managed care entities in the state undermine tribal sovereignty, straining tribal government's ability to oversee health care for their own citizens. The proposed task force in HB 1006 is a first step toward meeting mandated tribal sovereignty and self-determined care and capacity building in our tribal communities. It's a measure twice, but cut once kind of an idea. This is a huge shift, and we need to ensure that when we move in this direction, all stakeholders are in their proper place, ready to meet the needs of our Native relatives. The task force will be comprised of tribal designees, legislators, members of the executive branch, and members of our healthcare communities. This must be a full partnership, and I'm proud that this will be a legislatively initiated process. With the State Tribal Relations Committee, we, the State Tribal Relations Committee, believe moving in the direction of creating this task force and eventually working with the Indian Managed Care entity as a state will significantly improve health outcomes, which is a really big deal. And as I stated previously, fulfill the treaty obligations for healthcare in Indian country. Under our current model, many of our tribal members wind up on state Medicaid rolls, and it's the state's obligation, which it was never intended to be. We would ask that you honor the recommendation of the State Tribal Relations Committee and honor the request of our tribal communities. Once again, this is a significant change. The task force will design a firm foundation, and honestly, together, we may determine that we can't do it. It might be too big of a jump. But first, we need to take this step to gather the necessary stakeholders, get them to the table, and decide together whether we can do this, and if so, how. So I will turn this over now if there's anyone else as a proponent, and I stand by for questioning. Thank you.
Okay, thank you. Do we have any other proponent testimony? Good morning.
Good morning, Mr. Chair and committee members. My name is Heather Peterman. I am the Medicaid Director for the Department of Social Services, and I'd like to express support for the creation of this task force. Over 50,000 or 35% of our currently enrolled Medicaid individuals are American Indian. And under this option, as you heard described, the Department of Social Services, should the task force recommend, could contract with a tribally owned organization for the administration of the Medicaid benefit, which holds promise for improving health outcomes and promotes tribal self-determination. This task force work also complements well the work that will be occurring over the next several years under our Rural Transformation Program. The Primary Accountable Care Initiative similarly lies in this Managed Care Authority and has a common objective of strengthening an individual's relationship with their primary care team and shifting the way that we pay for health care towards value and outcomes. So we look forward to the transparent structure and opportunity that a task force like this would create to have those conversations about how to make this work well in South Dakota and most especially for our tribal communities. Thank you.
Okay, thank you. Do we have any other proponent testimony? Okay, seeing none, I don't think we have any online. Do we have any opponent testimony? Okay, one more time. Any opponent testimony in case you're on your cell phone? No. Okay, seeing none, no need for rebuttal. Open it up to committee questions if there are any. Okay, seeing no questions, well, closed testimony, move to committee action and or discussion.
Mr. Chair, I move do pass.
Second.
Okay, Senator Smith moves to pass on House Bill 1006, seconded by Senator Reed. Any discussion on your motion?
Yeah, thank you very much. This, as the good senator said, came out of a meeting that we had this summer, and it, I've been in a lot of different meetings and dealing with very similar issues throughout my tenure here, and this was one of the most productive meetings I think I've ever been to. The ideas that came from the tribes of things that we can do together to help healthcare for people in our state, and the initiative, there's a firm belief in the individuals that brought it forth that this can get done and it can help. And so I thank the committee for voting yes on this. Thank you.
Thank you. Any other comments?
Mr. Chair.
Senator Grove.
Something that I meant to mention during my testimony is this really was kind of birthed by Chairman Renville with the Sisseton Wahpeton Oyate, and I don't know if he's listening or not, but it's just a brilliant idea, and so I would appreciate your yes vote on this. Thank you.
Okay, thank you. Any other comments? Okay, seeing none, so the motion before us, a do pass motion by Senator Smith on House Bill 1006, seconded by Senator Reed. All those in favor say aye, opposed nay. Secretary, please call the roll.
Senator Grove,
Aye.
Harry,
Aye.
Reed,
Aye.
Smith,
Aye.
Voight,
Aye.
Davis,
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Okay, thank you. So House Bill 1006 does pass with a do-pass motion. Is there any objection to consent? Okay, we'll certify House Bill 1006 for consent then. And moving right along, we'll go to House Bill 1138, require the licensure of non-medical home care agencies and to provide a penalty therefore. Do we have any proponent testimony? Good morning.
Good morning, Mr. Chair, committee members. Melissa Heerman, representative for District 7. I'm happy to be able to be before you today on this beautiful day in March, of all things, where we're not knee-deep in snow. House Bill 1138 is a common sense consumer protection bill that is addressing non-medical home care services in South Dakota. This bill actually originated from a tragic situation involving a constituent in District 7. In that case, a woman living independently and experiencing the early stages of dementia was taken advantage of by a bad actor. The financial exploitation became so severe that it took her family nearly a year to unwind the damage and restore her estate. That experience raised some important questions. How can we better protect vulnerable individuals who are receiving care inside their homes? Today in South Dakota, the non-medical home care agencies have no regulation. They can operate without licensure, training standards, or background checks, even though their employees are often entering the private residences to seniors and vulnerable adults with daily living activities such as dressing, toileting, showering, etc. HB 1138 establishes very basic guardrails. This bill requires agencies to be licensed by requiring proof of 8 hours of caregiver training, the completion of background checks, and the submission of an attestation to that effect to the Department of Health. These are reasonable protections that many families already assume exist today. Let's talk a little bit about what this looks like in practice. As the home care agencies have been supportive of this bill, most of the effort and the work is actually going to fall on them. They are going to be the ones that require the 8 hours of training. They are going to be doing the background checks. They're going to sign an attestation that says they have indeed done so, and they're going to submit that paper to the state. As our population continues to age, more South Dakotans want to remain safely in their homes, and supporting aging in place preserves dignity, keeps families together, and is often a far less expensive option than institutional care. By establishing minimal standards and accountability, we help protect our senior and vulnerable population. We reduce the risk of abuse or exploitation and support a workforce that families can trust. First, this bill does not create a heavy regulatory structure. It was developed with a limited government lens. Any investigation in the bill is only complaint-driven and only related to the things that are required for licensure, such as background checks and training. There are no routine survey requirements. The intent is simply to establish minimum safety standards without creating any unnecessary red tape for providers or the department. Second, we're not asking to stand up a large new cumbersome program. Last year, the department had reported roughly 20 unutilized FTE positions. And that suggests that there is capacity, that this can be managed through existing resources if needed. And protecting vulnerable adults should certainly be among our priorities. If we were discussing similar safety precautions for children, I don't think there's a person here that would hesitate. We should be willing to apply that same level of care and protection to other vulnerable populations as well. The very heart of this bill is safety, dignity, and thoughtful protections to care for those who cared for us. And with that, Mr. Chair, I'll turn it over to some additional proponents, and I'll stand by for questions.
Okay, thank you. Do you have any other proponent testimony? Good morning.
Good morning, Mr. Chair, members of the committee. My name is Grace Gill, Director of State Affairs with the Alzheimer's Association here in South Dakota and registered lobbyist. We rise in support this morning of House Bill 1138. We are very grateful that the prime sponsor reached out to us as stakeholders early in this process and really appreciate the work she has put into this bill and engaging with all interested parties to make sure this bill does what she intends it to do: help people. As our population ages across the state, more families are turning to non-medical home care agencies for help to keep their loved ones at home independently for as long as they can. Currently, this industry has no formal regulations in South Dakota. There are over 16,500 individuals across our state who are living with Alzheimer's. For those individuals and medical services listed under Section 1 in this bill, like companionship, helping with bathing, dressing, assistance with self-medication, are the primary interventions that prevent falls, malnutrition, and medication errors. For a person with dementia, this is their primary care plan, but because those tasks have been classified as non-medical, this industry has been exempted from standards that other care providers must follow. Imagine one of those South Dakotans living with Alzheimer's. Let's call her Martha. Martha is in the middle stages of the disease. She's still living at home, 3.5 blocks away from her kids and grandkids, but she started to lose her way in conversations and gets anxious when the sun begins to set, a common behavior for individuals living with the disease called sundowning. So her family hires an agency to help her with dinner, make sure she turns off the stove, to help her get ready for bed, and to take the garbage out on Thursdays. They want to keep her close and at home instead of sending her away to an assisted living facility that perhaps is far away. Under our current structure, the person who walks through Martha's door might have no more knowledge about dementia and Alzheimer's care than a taxi driver. Even more concerning, because there are no state mandated background checks for these roles, her family has no guarantee of who is actually entering her home. They just have to trust the agency they hire. When Martha becomes agitated and insists there's a stranger in her house, another common behavior of the disease, an untrained worker might try to argue with her. They might try to raise their voice and correct her, and maybe even physically guide her to a chair. In the mind of an untrained aide, this response might make sense. But in the mind of Martha, an Alzheimer's patient, this feels like an assault. A situation that required a gentle hand and a redirection technique instead is now suddenly spiraling into a crisis, potentially leading to a fall or an unnecessary 911 call. This bill would start to change that. If this bill passes, the agency that Martha's family hired will be required to provide Martha's caregiver with minimal tools to succeed in her home care. Under Section 4, her aides would need to have training in areas like elder abuse prevention, safe bathing techniques, fall prevention, and at least 2 hours of specific Alzheimer's and dementia training. This training will help these hired aides understand that for folks living with the disease, aggression is actually fear, and how to respond in ways to join their clients' reality to help calm them down. It also provides an avenue for Martha's family if something does go wrong. Section 6 requires basic record keeping of Martha's care, and Section 7 ensures that if an accident or wrongdoing does happen, there are funds available to cover the damage through those liability policies. Currently, South Dakota requires licensure standards for other care providers like nursing facilities, assisted living centers, adult foster care homes, community living homes, and registration for residential living centers to ensure a baseline of care for those in those facilities. That standard for care should not change just because care is provided in a home instead of a facility. This bill is about setting professional standards for a growing industry that many South Dakotans currently rely on to remain independent in their home. We ask for a do-pass recommendation on HB 1138. Thank you. I will stand by for questions.
Thank you. Do we have any other proponent testimony? Good morning.
Good morning, Mr. Chair, members of the committee. Eric Nelson with AARP South Dakota. Rise in support of HB 1138 and ask you to support the bill. We believe that increasing the availability and quality of home and community-based services is a top priority for our organization and our state. In addition to HCBS services being less costly than facility-based care, we have surveys that reflect a strong desire for individuals to remain in their home as they age. Just last year, AARP South Dakota conducted a survey of our members, and it shows that over 83% of our respondents want to live in their homes as they get older, and 77% feel it's important to have quality long-term care in their community. Licensed home care agencies can play an important role in supporting people striving to remain independent. Requiring licensure of South Dakota's non-medical home care agencies will create important guardrails and protections to ensure that our state's most vulnerable receive safe and quality care. And for these reasons, we ask you to support the bill. Thank you, Mr. Chair.
And thank you. Do we have any other proponent testimony? Good morning.
Good morning, Mr. Chairman, members of the committee. Jennifer Stalley on behalf of Elder Voice Advocates. And from the consumer perspective, we certainly ask for your support of this bill. Has been stated before by the sponsor and by previous speakers. This is just setting minimum standards for the people that we're going to send into environments where we have some of our most vulnerable people at their most vulnerable time. I don't think that the requirements of this bill are overly onerous when you compare them to the requirements that the state is already putting on home care providers who are contracting with the state. So they're already asking for this training, they're already asking for these background checks, they're already asking for requirements of liability insurance. We're just asking folks that might be out in the market that are not state contractors to have to meet the same standards as the folks that we ask to help our folks from the state's perspective. I think that's fair to those providers, and I think it helps set that minimum standard. I would just also say that in addition to the consumer protection part of this, I think it's important because this committee in particular, and I know many of you as longtime legislators, spend a lot of time thinking about healthcare planning, healthcare costs, how do we meet workforce needs. This is really a piece or a part of the workforce train that we don't really understand who's providing these services, where those services are being provided, and how many people are actually in their home unless they're on a program that you're paying for. And so this helps us better understand where we have workforce capacity, where we might need to build workforce capacity, because I think, as Mr. Nelson said, the goal should always be to keep someone in their home, certainly as long as possible, because we know that that's the least expensive level of care when we start to get into a place where someone needs assistance with their care. And so for those reasons, we would ask you to support the bill.
Okay, thank you. Do we have any other proponent testimony? Any proponent testimony in the room? Okay, thank you. I think Dr. Heineman, are you online right now?
I am, Mr. Chairman. Can you hear me?
Yes, I can. So go ahead and introduce yourself and begin.
All right. Thank you. Good morning, Chairman Jensen and members of the Senate Health and Human Services Committee. My name is Dan Heineman. I'm a board-certified family physician, but I'm also a member of the Alzheimer's Association's Board of Directors and a medical director in long-term care. Today, however, I'm speaking to you as an individual and a resident of District 10. My mother passed away from Alzheimer's disease in 2010, and my father was her caregiver for a long period of time. Today, I'm asking you to support House Bill 1138. This bill will provide assurance to families that the providers of non-medical care that they contract with will have had at least a background check, completed some basic training, and have liability coverage. In South Dakota, there are over 17,000 individuals living with dementia today. Much of the care provided to them is provided by their families and is uncompensated, creating a burden on these families. This legislation will provide some assurance that their loved ones that are not being taken advantage of when they contract for some non-medical care or financially compromised by fraudulent means. I believe that it is the responsibility of government to assure our vulnerable citizens are protected. We owe that to them and their families and caregivers. For this reason, I urge you to support House Bill 1138 and congratulate Representative Heerman for identifying an issue and bringing forth a solution. Thank you for your time and attention, and I will remain available if you have questions. Thank you.
Okay, thank you, Dr. Heineman. Next, I think online we have Gabriel Hoing. Are you online right now? Gab, go ahead and introduce yourself and begin.
Good morning, Mr. Chair and members of the committee. My name is Gabrielle Hoing, and I own and operate Core Cares, a home care agency serving individuals across more than 40 counties in South Dakota. Thank you for the opportunity to provide testimony in support of House Bill 1138 and for your willingness to engage in thoughtful discussion about the standards around non-medical home care in our state. I would also like to thank Representative Herman for being open to feedback and collaborating throughout the process. It is clear that our intent aligns to ensure our neighbors and loved ones receive safe, high-quality care in their homes. I would like to briefly address the term non-medical home care, as it can sometimes be misleading. While some individuals may receive limited services, such as weekly housekeeping, many others rely on home care agencies for extensive, even round-the-clock support. Our caregivers routinely assist with feeding, bathing, dressing, transfers, and personal cares. They may empty catheter or ostomy bags and provide hands-on assistance that closely mirrors the duties of a CNA in a nursing home setting. We care for individuals who are, due to illness, injury, disability, or the aging process, require assistance in order to remain safely and independently in their homes. The level of responsibility carried by home care providers should not be underestimated. South Dakota has a rapidly aging population. With that reality comes a growing responsibility. When I started my home care agency, there were approximately 10 primary home care agencies operating in my area. Today, there are more than 40 in that same area and more than 100 across the state. While growth can be positive, the lack of regulation and oversight has made South Dakota very attractive to outside entities that see an opportunity to enter the market without offering the consumer protections to clients that many other states require. Earlier in my career, I worked for an organization that operated in multiple states. Compared to standards in many other states that oversee home care, the framework proposed in House Bill 1138 is very minimal. Any provider with contracts with Medicaid for waiver or non-waiver services must follow guidance that is far more stringent than what is proposed in this bill. Those providers continue to operate successfully and serve South Dakota every day. House Bill 1138 establishes a basic floor of accountability while still allowing providers flexibility in how they operate. I, as a provider, am already following all the requirements in the bill, and then more. However, there are providers out there who are not, which put our vulnerable patients at risk. This legislation simply helps ensure we know who is providing care in our communities and that they're meeting basic standards designed to protect vulnerable individuals and their families. It also sends a message that in South Dakota, quality care matters. Regulation done thoughtfully is good for consumers, good for reputable providers, and good for long-term sustainability of home care in our state. I respectfully ask for your support of House Bill 1138. Thank you for your time, your consideration, and your commitment to the people of South Dakota.
Okay, thank you. I think that was the only other. Do we have any other proponent testimony online for House Bill 1038? Or 1138, excuse me. Okay, seeing none. Do we have any other proponent testimony in the room? Okay, so now we'll move to opponent testimony. Good morning.
Good morning, Mr. Chair and members of the committee. My name is Cassie Deffenbaugh. I am a division director in the Department of Health, responsible for overseeing licensure and accreditation. I respectfully come before you today requesting your no vote on House Bill 1138. And before I get started in the opposition, I do just want to recognize that this is a well-intended bill. Protection is important. The testimony that I'll provide today does not diminish the compassion and the efforts behind this bill. We just feel that there are some unintended consequences and some things that should be considered when you're determining whether or not to vote yes or no on this bill. To start with, my Office of Licensure and Certification regulates healthcare facilities. So you might think of hospitals, critical access hospitals, nursing homes, home health agencies, among many other that are regulated in the healthcare industry. We both federally certify these facilities and also state license these facilities. So when we look at this bill, one of the concerns that we have is related to the definition of non-medical home care agency. It is defined as a person that for compensation and as a regular part of business provides or employs or contracts with home care aides to provide non-medical home care services intended to enable a client to remain safely in a client's personal residence. So I'm going to take out the or. A person that, for compensation and as a regular part of business, provides non-medical home care services intended to enable a client to remain safely in the client's personal residence. This definition is very broad. It is so broad that it has the ability to capture anyone who is performing these tasks. The way the definition of non-medical home care services is written, it does say that 2 or more of those services when provided by a home care aide. However, it does not include that person who is defined as an agency. There are some single service providers, there are sole source or sole proprietors that could be doing this work that would be encompassed in this. And so some practical situations that I'll share with you is, for instance, a small family-run cleaning business in a rural community that is providing light housekeeping for seniors. They're vacuuming, doing dishes, they're doing occasional laundry. Those people would be inadvertently looped into this because of the definition of agency. In addition, you think of small local businesses providing meal delivery services. They might be doing some housekeeping as well with that, helping seniors stay in their homes, which again is the intent of this. We want to keep people in place, we want to protect them, but it is inadvertently bringing in other small businesses or community providers who may not continue this work if they are regulated and required to do some of the things in this bill. Additionally, you think of impact to our rural areas who lack providers, lack transportation, our reservations that need providers to do this work. For instance, a community program on a reservation helping elders remain independently by offering assistance with errands and transportation to and from appointments. These individuals would now be required to be licensed by the state of South Dakota, have background checks completed, liability insurance, and training standards. So there are some, I think, unintended consequences here based on some ambiguity in the definitions. And I think those should be considered when looking at this because I think there are some unintended consequences of this. In addition, what I would say is, our work in regulation and enforcement in the Department of Health really does a great job. Our team, they're excellent at what they do. We take our job very seriously. It is a privilege to do the work that we do, and it's a privilege to be trusted with that work. This, as the representative indicated, it restricts our enforcement and our compliance to paper compliance. It is not looking at care. It is paper compliance. We are verifying through a background attestation by an agency, self-attested, that they did background checks and they were okay. We do not have the ability to look at those background checks based on how the bill is written. We are relying on self-attestation by those agencies that they have done that work. We can review their liability insurance and determine whether they've received that. We can also verify that they've had training standards met. But these are not care outcomes or client outcomes that we are able to look at. We are merely reviewing paper and relying on self-attestation. It also requires that inspections are limited to business hours, which is appropriate. We're okay with that. But it requires reasonable cause and advance notice. Reasonable cause would be a complaint-based survey. The initial bill that was provided was we had the ability to do routine inspections, which is more preventative and proactive oversight. But with reasonable cause, it is complaint-based. We also have to provide advance notice, which allows agencies, providers, and other to correct issues before we are able to investigate, potentially hide issues, our ability to identify systemic issues or even acute issues related to abuse or neglect. We really would lack that ability to do that. And also, the way the bill is written, it requires us to do complaint procedures under Title 36, which is typically for professions or occupations that are licensed, such as nurses, physicians, and others that have individual practice and scope of practice. We operate under Title 34 typically, which has established standards for regulating the facilities or agencies that provide care. And it is established health and safety oversight that Title 34 offers. So it puts us in kind of a role of what the boards and commissions would do for regulation of a practice. In addition, when we look at the work that's being asked, it's been mentioned that no FTE would be necessary. Unfortunately, we don't have the ability. Those FTE are regulated by, whether or not there's federal funds tied to them. We can't just reallocate them to another position type. It would be unacceptable by the federal government, as well as some of the other support that we're providing. We did provide some initial estimates based on the bill and a fiscal impact with travel. It's also been indicated that we would not need to travel. So again, we're doing off-site paper compliance review of this work, which consumers expect more. They expect more of us. If we get a complaint about how their loved one is not receiving adequate care, we don't have the ability or authority to establish care standards. There is no care standards in this that we would say. What we would have to review whether they've had a background check, their attestation of that, whether they've had training standards. We have the ability to look at client records, but there's no care standards established for non-medical home care. We do not have the authority to promulgate rules for care standards for non-medical home care agencies. So if we get a complaint about a choking death, there are no care standards established for us to regulate to or enforce. We only can verify background checks, liability insurance, and whether or not those individuals have received training. And if they are compliant with their paperwork, they are compliant. That is our extent of our authority. When you look at the additional part, like I said, we do have in one of the sections the ability to review client records. There's some concerns about some of the language in there about confidentiality and client authorization and whether the department would be able to actually review those records without client authorization. But again, reviewing those records when you don't have care standards is not effective. We also don't have the authority to, in addition to establishing care standards or safety standards, require adverse event reporting. Typically in healthcare facilities or any other facility that we regulate, there is requirements to report unintended death, abuse, neglect, falls resulting in harm, among other things, to the department so we can investigate those. There's no ability to do that. So again, you have these complaints the department would receive and no authority to really do anything with that except for review that paper compliance. When we look at the framework that is provided here, even serious events will not result in a proper investigation. And when we look at some of the other areas of this bill, the training requirements, that's an excellent idea. The department has the ability to promulgate the standards for those training requirements. But when you look at, again, some of the ambiguity and definitions, it says that home care aides must have those requirements. But if you have a sole proprietor or a single service provider who's providing those services to include bathing or toileting or other assistance, that agency is not listed in there. It's just the home care aides that are employed by or contracted with. This results in some inconsistency and some ambiguity again as well. Again, the background checks, we don't have any ability to look at those or verify those. Those are self-attested. And if you consider single service providers or single person agencies, they have the ability to self-attest that their background check was appropriate. And that would be, a concern that we have. We also, in looking at client records without having those established cares, it prevents us from holding these agencies accountable to those standards, and again reverts us back to that administrative oversight and paperwork compliance and looking at that. Our revocation or suspension of licensure, again, limited to paper compliance. If we have terrible falls that are resulting in injury or there's ongoing issues or trends occurring in a facility, if they're compliant, and our ability to enforce would be very limited. We also talk about the liability insurance. There is a $250,000 per occurrence liability insurance for all providers, including those single service providers, that may disproportionately impact our small or rural agencies and reduce service availability. But there's been no fiscal impact determined as to what that will be for those providers. So, and at the end of this, I think there's opportunity. I would say that we don't feel that this bill is ready to go as it is just because of the ambiguity and how things are written here. It is regulating paperwork, not care or client outcomes, and the overly broad definitions pull in those ordinary service providers and really limit our ability to investigate safety or enforce some concerning situations, especially the ones that have been brought here today. Those concerns are limited to us reviewing paperwork and not really being able to effectively investigate and enforce those concerns because of lack of care standards. So when consumers report complaints about the care and safety of their loved one, they expect a meaningful investigation. So I, again, respectfully request for your no vote on House Bill 1138, and I stand by for any questions. Thank you.
Okay, thank you. Do you have any other opponent testimony? Good morning.
Good morning, Mr. Chair, members of the committee. Lisa Gennaro, and I'm representing myself today. I'm an owner of a non-medical, medical, and home care agency in Keystone, South Dakota. We provide compassion, we provide bathing, dressing, grooming, preparation, for people who are at home. Many of our clients receive services through LTSS and DHS contracts under Medicaid and HOPE waiver. I know the people that are bringing this bill, I agree with a lot of what they're saying, but we also need to understand that sometimes people don't understand the difference between like Department of Health and Department of Human Services. Department of Health does not regulate or license non-medical home care agencies today. They only do skilled medical home health services, as you heard. The Department of DHS and Division of Long-Term Services, they enroll the agencies. We already comply with strict DHS rules, fingerprinting, background checks, 6 hours of initial training within 30 days, and then we have to get everybody together and do a 6-hour training every twice a year. This includes also prevention, safety, participant, the rights, fraud. We go into all that. The employees have to clock in and out with a thing called THERAP, so everybody knows where the employees are and if they're at the actual clients. Many of these agencies likely also serve some private pay clients. We treat them just like we do clients who are contracted. Section 12.5 of the bill exempts any person who provides services under Medicaid waiver programs administered by the Department of Human Services, which covers our LTSS HOPE waiver funded clients and services. That's appropriate. However, the exemption is tied to specific waivered funded services, not the agency as a whole. For agencies like mine, this also serves private pay clients. This bill is broad definition of a non-medical home agency. Would likely still require us to obtain a separate DOH license to cover these private pay operations. So this might be making us have a duplicate license. We right now do the training, like I said, but in their bill, they're wanting to do, with every new employee, 8-hour training. My office manager right now does the training, but we hired like 4 people last week, a couple weeks ago. And she would drive all the way from Custer, maybe to Spearfish. That's almost 40 hours of her taking her time away from the office. Rather than this duplicate bill, I urge the committee to consider a path expanding existing DHS LTS rules to include targeted safeguards for private pay agencies. This would be a better fit. It would also be where we wouldn't be possibly having a duplicate license, duplicate hours of training, everything else, and they are already going to be falling under these strong rules that DHS already has. I just hope you please vote no on this particular bill through Department of Health. Thank you.
Thank you. Do we have any other opponent testimony? We have none online, so it would be time for rebuttal.
Thank you, Mr. Chair, committee members. Melissa Heerman, representative for District 7. Okay, I'd love the opportunity to just respectfully address a few of the concerns that have been raised today. In some of the opposition, we heard that the bill creates too much work, but I also heard some comment that it doesn't go far enough. I want to bring us back to what the bill actually does. There is a gap in the process, a gap of agencies that are not regulated today. We've identified this gap in how we protect the vulnerable population in South Dakota. The agencies would be required to have their employees pass a background check. Now, I heard a little bit that maybe this bill doesn't go far enough, and I can agree with that. It maybe doesn't go far enough. It maybe should go farther, and maybe that's a bill for another year. But the goal is to ensure that the people entering into the homes and private spaces of vulnerable people aren't already known sexual assault or predators, have a history of theft or abuse, that are being entered into the homes of people perhaps who, in the case of someone with dementia, there could be sexual assault that occurs weekly, daily, monthly. That is an incredibly difficult problem, not only to catch, because they may not recall, but also to be able to intervene and stop the abuse from occurring. So this means someone with a history of sexual assault and theft won't be invited into their homes, which is the whole goal of the bill. It does not include housekeeping or a transportation company or any other organization whose sole area of focus is only one of the items listed. I worked palms up with multiple stakeholders, and I worked with LRC, who did an amazing job multiple times to ensure that we have met this concern. And I feel confident that we have at this point. I've also heard a concern that this responsibility might be more appropriately aligned under a different department. You know, what's interesting is that on the Department of Health's own website right now, it states that non-medical home care agencies are not regulated in South Dakota. This statement appears within the Department of Health's Health Facility Licensure section, which inherently suggests that if this area were regulated, it would logically fit within the existing licensure structure and framework. Because this bill focuses on agency licensure, training, and background checks, placing it within the Department of Health aligns well with other similar provider licensing procedures. Another important point is that South Dakota currently has very little visibility into this industry at all. Because there's no licensing requirement. We don't have a reliable way to know how many non-medical home care agencies are even operating. Establishing licensure would also provide basic transparency so that we know who's even working in this space. It's also worth noting that most states already require some form of licensing or registration for non-medical home care agencies. South Dakota is actually the minority of states that currently has no oversight. This bill simply brings us closer to what many other states already consider a baseline safeguard. At the end of the day, we're not asking for anything excessive. This bill is simple, intentionally simple, requiring the agencies to be licensed, provide proof of training. And on the training piece, if you are hiring people who have already gone through healthcare training, they are already waived from that 8 hours. And when we're talking about 8 hours, I know it can feel a lot, but I think it's 40 hours of training required to do a home inspection. I think it's 600 in cosmetology and other areas. So we did put in 8 hours because I think that's important. But also, again, it's a baseline safeguard. Making sure we're not allowing a bad actor to walk into the personal homes and private spaces of our elderly and vulnerable neighbors is important enough to require at least these basic protections. And let me tell you, I've approached this bill palms up. And some of you have seen me work through other bills. I truly believe the best legislation ends up landing in a space of compromise. And maybe everyone's a little bit unhappy, but you walk away with probably the best bill you can, and that's what good compromise looks like. Every bill I've had so far this year, I've been able to reach that place. And I will be very honest, I've worked hard on this as well with this bill. I've come back and worked multiple times to try to make sure there was no issue or concern with some of the things that were brought up. You will see the amendments on this bill because I've done just that. I've actively listened, I've heard the concerns of the department, and worked tirelessly to combat kind of each new round with a genuine and authentic approach. At the end of the day, this bill simply establishes basic guardrails so that when South Dakotans open their homes to receive care, they can do so with the confidence that some type of protections are in place. And I would ask for your support of the bill. Thank you.
Okay, thank you. With that, we'll open it up to committee questions.
Mr. Chair.
Senator Grove.
I have a question for Ms. Steffenbaugh. Mr. Chair. Good morning. You said some of the things super fast, and my brain is like functioning really slow this morning. So first of all, can you explain, like, just briefly, when you're talking about single service provider, so what is that?
Cassie Deffenbaugh, Department of Health. So those could be, because of the way the agency is defined as a person that's providing those services, it could be someone that is providing companionship. It could be someone that's providing household chores in the home to allow someone to stay in their home independently where they are at. Some of the non-medical home care services were companionship, meal prep, housekeeping, chores, errands. And then, of course, the others, which I think are probably the more concerning areas that people have been talking about, is bathing and dressing, toileting, grooming, eating, self-administration of medications. So the way the bill is written as an agency, or the person providing that care, is people that are providing light housekeeping, running errands, transportation to appointments, those types of things. There is also one part in the non-medical home care services section that is any other activity of daily living that allows someone to stay in their home. It is so broad that it can include a lot of different single service providers. Handyman, I think that was maybe an example of a situation that resulted in some not good situations, but this bill brings some of those types of providers into regulation, I believe unintentionally.
I have two more questions, Mr. Chair, if that's okay. In the tribe, we have you have CHWs, we have CHRs, and they tend to perform a lot of what you just talked about. Not the toileting and all that kind of stuff, but more of the running errands and that type of stuff. Would this impact them?
Our understanding is that it would.
Okay, and then just one more question about the other aspect, the toileting, bathing, and et cetera. What do you currently have in place that, what protections do you currently have in place that the bad stuff doesn't happen to the degree that we would hope that it would never happen, but it does. But what do you have in place for that?
Yep, Mr. Chair. Cassie, Department of Health. The Department of Health regulates home health agencies, which provide skilled services. They often provide bathing, dressing, toileting, eating, assistance with those things, as well as the Department of Human Services has their waiver that's been talked about. So they have their contracted services that are regulated by them for providing those types of services. They're reimbursed. As far as non-medical home care agencies, the department doesn't have any current regulation, but there is still reporting mechanisms to Adult Protective Services if there's concerns. That's not within the Department of Health, but that's a reporting mechanism. The clients are limited to 18 and older, so Child Protective Services wouldn't apply, but in all situations, law enforcement, of course, is still a reporting mechanism here. You can have a background check and still do things that unfortunately are terrible situations. You can also pass a background check, and those things can still happen. There's really terrible things that happen, and we agree that the protection is important and take that very seriously as well. But again, there's just some challenges with this. And again, we're talking about care standards, but inability to enforce care standards.
Okay, thank you. Any other? Senator Perry.
We'll stay with you, if that's all right, Mr. Chair. I think inadvertently we're bringing in different servers. And can you kind of name off some of those servers? And is there potential for this bill to be able to fix those?
Mr. Chair, Cassie Deffenbaugh, Department of Health. Yes, we do feel that there are other service providers that would be included in this. So I would say maybe some of your community organizations, community programs like on reservations that are providing transportation or household chores to keep people in their homes. You could look at faith-based services that are receiving compensation for the work that they do with meal preparation and other. It does, again, in the bill, it defines non-medical home care services as 2 or more provided by a home care aide, but those agencies are not in that, so it's understood that they could be providing one of those services or 2 or more. Oftentimes you might have someone who's maybe a woman who is providing, or an individual, I should say, that is providing errands in the home, providing transportation, doing some cleaning and meal preparation that we believe would be included in this as licensed, requiring to have liability insurance, requiring to have background checks, among others that are required in the bill.
I'm not sure if the sponsor of the bill or if it's you, but what does it cost per contract?
Mr. Chair. Melissa Heerman, representative for District 7. Right now in the bill, excuse me, right now in the bill, there's a fee for up to a maximum of $100 per license.
For the prim sponsor, Mr. Chair.
Okay, Senator Davis.
So we're hearing that handymans, taxi drivers, people like that would be looped in here. I mean, line 16, page 1, clearly states 2 or more of the following. I mean, and then there's all these things listed below. I mean, I don't consider a handyman an activity of daily living because I don't on a daily fix my doorknob or fix the sink. I'd probably have more problems if that was the case. But I'm just curious, I mean, how do you respond to those concerns?
Mr. Chair. Melissa Heerman, representative for District 7. You're spot on. So the idea that this could impact, Meals on Wheels or cosmetologists or other industries that might go into the home to help seniors, that is not how this bill is laid out clearly. If their sole function is to do hair, that is not 2 or more of any of that list. If their prime objective is to do transportation, that is also not 2 or more on this list. Same with Meals on Wheels. Their primary focus is to drop off meals for those who need, and they also would not be on this list. So it has been a compelling argument, perhaps, if it were true, but we have worked very hard with LRC to ensure that that is not the case by including that language in there. There also was a question earlier on about if this would impact nannies, and we addressed that right away as well by adjusting the age of the client or individual to being over 18. So we've put a lot of work into ensuring that none of those other groups would be impacted by this.
Any other questions from the committee? Senator Perry.
I'd like to have the Senate Prime come up and just give her evaluation of what we should be doing.
Good morning, Senator Stephanie Sauter, District 4. I chose to be a Senate Prime on this bill because it has affected my family. Luckily, not in improper ways. We did have private health care or home care for my parents for a while, and we could have gotten into situations, but we were diligent in watching what was going in there, and we were fortunate because we were close by. But I appreciate this bill, and I appreciate Representative Heerman for bringing this because, again, we talk about our most vulnerable, and we first think about our children, but we do need to think about our elderly and these folks that are home, and we all know somebody. None of us are without a knowledge of, we all got somebody in our mind that we're thinking about when we hear about this bill. So that's how I chose to be a part of this.
Okay, thank you. Any other questions from the committee?
Mr.
Senator
Chair.
Davis.
I do.
Mr. Chair, I'm going to arm wrestle you. Could I ask Ms. Steffenbaugh one more question? Thank you. Do you believe that there is a potential for a problem? And if so, is there a one of the other people that testified as an opponent thought that there was a better way to potentially address issues. What do you think on that?
Mr. Chair, Cassie Deffenbaugh, Department of Health. I do think that there are unintended consequences of this bill, and I think we would work with the Prime and the stakeholders of the bill over the next year to come up with something that is reasonable and really meets the intent of what's trying to happen here. There were other solutions I think brought that can be considered regarding this. There are established mechanisms in place or safety measures in place through DHS. That's something we can consider, but also again, just looking at some of the definitions in the bill, I did just also want to clarify that the agency, I think, is the challenge here and how that is defined as a person and why we feel that some of these other small businesses and other are getting looped into this unintended. But I do think that there's opportunity to talk through things, but we just don't feel that the bill is ready.
Senator Davis?
Thank you, Mr.
Yes,
Chair.
go ahead.
Question for Ms. Stolle. You talked about this protecting consumers. Do you think it goes far enough to protect consumers?
Mr. Chairman, Jennifer Stolle for Elder Voice Advocates. Thank you for the question, Senator. I would agree wholeheartedly with the prime sponsor. I think that this is probably the lightest touch in this area that we can have. I think it's a good first step. I don't think that when you look at regulation across different facilities, different professions, that this is even close to what we expect of some folks that are dealing with far less vulnerable people than what this bill's dealing with. I think that you've had some questions, Senator, that have come up about definitions. I think it's very important to understand that LRC is helping to craft these, and when we start to say that an agency can't be a person, I think all of you know that a person can be a corporation. I mean, we're kind of getting into semantics that are really legal terms. We're talking about the people who are going to be in our homes with the most vulnerable people. So in a perfect world, would we like to see that there is more of an inspection and more of a proactive approach to how the department would regulate these providers? Probably, honestly. But we also respect that the department has told us that they have capacity problems, and I think that's why Representative Heuermann has scaled this bill back to be very much about meeting some minimum standards. I don't know if it was in this committee, and I apologize if it had happened in appropriations, but as a consumer group, we're very aware that the Department of Health has testified to this body that they've seen an over 500% increase in the complaints in assisted living and in nursing homes, an area where they are regulating the facilities. That's a very real problem, and I want to be part of helping them solve that, but I'm also aghast to think what's happening in an area that's unregulated. And so I think we're doing the lightest touch that we can do here. In the way that makes it so that the providers like Ms. Gennaro, who are already providing these services and already subject to these requirements by virtue of working through the LTSS program and DHS programs, that the people who are essentially her competitors are also being required to meet those same standards. I think this is the lightest touch. We'd like to see more, but we certainly think this is the step that needs to be taken so that we can start to protect these folks who are in the home care setting. Thank you for the question.
Okay, thank you. Any other questions from the committee? Okay, seeing none, we'll close testimony and move to committee action and or discussion.
Mr. Chair.
Senator Reed.
Thank you, Mr. Chair. I move due pass on House Bill 1138.
Senator Reed moves due pass on House Bill 1138, seconded by Sidney Davis. Any Senator Davis, excuse me. Any discussion on your motion?
Thank you, Mr. Chair. Well, first, this problem, or I should say where we're at right now, is going to get larger and larger. We've got a big kind of collision of a lot of factors here. Aging population, an aging population that also, being the boomer generation, has funds that can help them stay in their home. And then we also have where sometimes it's a sandwich generation where parents are taking care of their kids and taking care of their parents. And that creates a lot of pressure. And so and then you also have where, because of how our families are more spread out, and they're just not there for the care either. And so this business is going to grow. And I believe that this is a really good first start. I totally agree in the light touch. I think there's been a lot of work done to make sure we're not pulling in those that shouldn't. And I do believe we're going to have to continue on with this, but we have to get started as soon as possible. And I think this is a very good first start.
Okay, thank you. Any other comments on the motion?
Mr. Chair.
Senator Grove.
I'm going to resist the motion, and I just wanted to explain why. I think, first of all, the senator, what she testified is really what it's about. I think the families have to be involved. It's like having a child and taking your child to daycare. There's some due diligence, but you keep up to speed with what's happening to your child so that they're not being abused. And our parents, which I had to take care of, my parents as well, both have passed away, and I was solely responsible for ensuring that they were well provided for in their aging process. And it was my job to be involved, to know who was taking care of them, to make sure that crazy stuff wasn't happening, and I was their advocate. And so it is up to the family to participate. I think that there are rules and regulations in place. However, it sounds like we do need some fixes here and there, and it sounds like the department is saying, hey, we want to work on these, but let's at least work on them put them in the right spaces. And this bill does not do that. And for me, as someone who's representing 3 tribes, this will impact the CHRs. They there was up to 2 things that you have to do, and they do those things. And so you're talking about these folks are going to have to spend $100, I guess, is the fee to get licensed and go through all these courses and classes. And not that that's not worth it. I don't mean that in any way, but it is going to be difficult for the people right now that we have in the tribes that are using CHRs, and they are a huge part of how the system works out there. And so I'm going to resist. I think that there's things that need to happen, and I think that the department is willing to work on those. I think we just need a stronger bill. I don't think this one's ready, so thank you.
Mr. Chair.
Okay, thank you. Senator Smith.
Thank you, Mr. Chair. I'll be voting yes on this, and I want to vote yes on this for my Aunt Barb, for my friend Dave, for my friend Jack, for my friend Ann, and I could keep going down the list. My cousin, who had to work for multiple years with his mother, who lived right across the street from me, to find the services necessary to make her be safe, was an incredibly difficult time. I didn't know we didn't even have a safety net on some people providing services. Now, for her, she was a Medicaid, so it sounds to me like there were safety nets for her. But I think all families should be ensured that there's at least a base level. I don't think we're asking too much here. Multiple things that I've done in my life that don't require this much personal care and this much intimate care have had background checks. So it might not be what the department wants right now, but I don't think we're asking them to do too much, and it sounds like they're willing to do even more. And that would be good, but let's get started now. Thank you.
Any other comments? Senator Davis.
Mr. Chair, thank you. Well, I think it's important to remember that other healthcare workers like CHRs, they're already licensed and they practice within their scope of their licensure. So that is really important to remember in this bill, because this bill is talking about an area of service that is currently not regulated, and it explicitly says that on the Department of Health website, that these types of services are not regulated within this state. We are not talking about people that are already receiving care like this that are under Medicaid or other types of waivers. We are talking about folks that are private pay, and it's the Wild West. There's literally nothing. There's no floor of accountability. This bill establishes a floor of accountability. I came into this looking at this legislation very skeptical, and the sponsor and the proponents know that. And I had a lot of questions, and was very concerned about all of the unintended consequences that a lot of folks were talking about. And my concerns were more than satisfied. I walked through line by line and have the bill marked up, as the good chair will probably see sitting next to me, of where my concerns were and where they were where my questions were answered. And so I think it's important to remember that this is establishing a floor of accountability in an area that is completely unregulated on individuals that are private pay. And so that's why I'm happy to support the motion. I appreciate the good representative and all of the work that she's put into it. I know she's a thoughtful legislator. And so I'm confident that this is a good bill and that it is ready for right now.
Thank you. Any other comments? Senator Voigt.
Thank you, Mr. Chair. I think we're at a point here where we're looking at a stew, and a lot of pieces in that stew, and we have yet to put that in the pot and really address those that we are responsible for in terms of the quality of life, and looking at that end point. We need to put a stake in the ground and get started on it in lieu of having it fragmented. And as a society or responsible legislators, not driving that stake to something significant that takes care of that need. We are at a beginning point, and I thank that representative for putting that stake in the ground. I'm going to support this bill.
Okay, thank you.
Mr. Chair.
Senator Grove.
Let me say one more thing. I just want to say, I want to reiterate what, I don't remember where she's from, Ms. Deffenbaugh said. She said that there's no care standards in this bill. Background checks will be paper only for them. Confidentiality will be removed for them to a certain degree. Reverse event reporting, which is, from what I understood from her, was investigations will be seriously impaired, and which means the serious events will, when they're investigating those, are going to have issues. So what we're trying to do is we're trying to help and put these things in place, but at the same time, there's all this ambiguity, and we're going to tie the hands of the organization that we're saying isn't doing the right stuff. So it's not ready. I don't know what we're doing, but I would just say resist this motion. Thank you.
Senator Perry.
Thank you, Mr. Chair. And I believe that aging population was one of the things that was said here. The other thing is, I've been a member of Dementia Friendly America before, and I think this is a step to help those that really can't help themselves. And I do agree with the department when they say that there's going to be a lot of peripheral services that will fall into this. I don't know what those services are, but if we don't take a step forward, we never go anywhere. If I waited for all the stop signs to turn green to go to Chicago, I'd be in Aberdeen or I'd be in Pierre for a long time. It just doesn't happen. This is a step in the right direction. This is turning one stoplight green, and I think we can move forward. So I'm going to be supporting this.
Okay, with that, I'll just make a quick comment. My mother-in-law, a couple of years ago, had some outside services coming in. She was a victim of theft, and we actually caught it on camera, the theft going on. And the police department did very little about it. But my concern here is I'm going to be a no, because I like the idea of the bill, but I really think we should have been building on human services, because this is really the area of human services. I mean, that's in their wheelhouse. Department of Health, I mean, to me, it seems like it's in the wrong place. And if we already have some regulations, again, we'd have to be duly licensed by the Department of Health and the Department of Health, Human Services. I think we just split the road, and we're going to duplicate all of the problems. It just, when we duplicate the licensing, it just doesn't make sense to me. So I'll be a no. But anyway, with that, I'll ask the Secretary to call a roll. Do pass motion on House Bill 1138, and I apologize, I can't remember who made the motion. Senator Reed, seconded by Senator Davis. Okay, thank you. With that, I'll ask the Secretary to call the roll.
Senator Grove.
No.
Excuse me. Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
No.
Mr. Chair, we have 5 yeas and 2 nays.
Okay, thank you. With that, House Bill 1138 will move to the floor with a do pass motion. Thank you. Now, hopefully moving quickly along here, we'll move to the next bill. House Bill 1148, adopt a respiratory care interstate compact. Do we have any proponent testimony?
Good morning, Mr. Chair, members of the committee. HB 1148, this is another compact licensure bill, this time for respiratory therapists. So this compact would operate much like our other healthcare licensure compacts functioning successfully in South Dakota. This creates a streamlined pathway for respiratory therapists who hold active licenses, and it would allow them to obtain a multi-state license in participating states. South Dakota has a small but incredibly important respiratory therapy workforce. These professionals are essential in emergency care, chronic disease management, neonatal care, and ensuring coverage in our rural hospitals. At a time when our healthcare workforce shortages continue to challenge access to care, improving mobility for our qualified respiratory therapists is a practical step. It strengthens timely life-saving services for our communities. And importantly, just as a reminder, these compacts do not expand scope of practice or weaken oversight. These therapists remain fully subject to the laws and regulations of our state where they are practicing. It simply removes duplicative licensing barriers, supports our military families who are frequently relocating, and allows those qualified providers to begin serving patients immediately, or I should say more quickly. I would ask for your support on HB 1148 to improve access to care for our patient populations throughout the state. Thank you.
Okay, I probably should have said this up front. We still have a couple of bills to get through, so we're going to kind of try and limit it to about 10, 11 minutes of it on the side.
My apologies, Mr. Chair. I did not introduce myself for the record. Senator Sidney Davis, District
Thank you very
17.
much.
Thank you.
Okay, so do we have any other proponent testimony?
Mr. Chair, Cassie Deffenbaugh, Department of Health. We are a Me Too on this. We support strengthening our workforce and increasing access. And if you've ever had to work with respiratory therapists, they are essential to the services that they provide. Thank you.
Thank you. Do we have any other proponent testimony?
Mr. Chair, good morning. Tim Rave, members of the committee. Sadaho, rise in support of the bill, Mr. Chair. You guys have had many of these compact bills, and they're very thoroughly vetted out, and it's a good thing to pass. So I ask for your support. Thank you.
Thank you. Do we have any other proponent testimony? I think we have one online.
We have one more in the room here.
Oh, one more in the room. Go ahead. I'm sorry. Here. Oh, pages are missing. Oh, right. Go ahead and introduce yourself and begin.
Good morning, Chair and the committee. My name's Kathy Mitzel. I am a respiratory therapist in South Dakota. Just as a precursor, when I mentioned my employer, I am not here on behalf of my employer, it's just my experience. I've been a respiratory therapist for over 30 years in South Dakota. I live in Aberdeen in District 3. However, I drive and work at Avera McKinnon in Sioux Falls as a registered respiratory therapist. I do have a bachelor's degree, and the areas that respiratory care covers is very vast, anywhere from mechanical ventilation in the home management, tracheostomies, flight team. Currently, our flight teams are being required to get additional licenses anywhere that helicopter or plane flies to, which they have gone all the way to Denver, Colorado, and even over to New York. And that's just out of Sioux Falls alone. So they're requiring to get licenses in all of those states. On behalf of the South Dakota Society for Respiratory Care and the practicing respiratory therapists across our state, we respectfully urge your support of HB 1148, which would authorize South Dakota to adopt the Respiratory Care Interstate Compact. Respiratory therapists are essential healthcare professionals who provide critical care across all ages, from birth. Any C-sections, respiratory therapists are required to be there, all the way up to their last breath. From mechanical ventilation management in intensive care units to emergency respiratory support, emergency flight response, chronic lung disease management, pulmonary rehabilitation, in the home with durable medical equipment, and life support care in rural hospitals, long-term care facilities, and inpatient homes. When a South Dakotan is struggling to breathe, respiratory therapists are often the clinicians at the bedside, ensuring patient safety and optimal outcomes. Many people had never heard of a respiratory therapist until COVID hit, but I will assure you we have always been there. In the hospitals, we have been known as the Batman. No one ever sees us. They call us, we swoop in, we take care of it, and we leave. The reason for that is we are a very small, we're a small sect when you look at the entire healthcare field. In South Dakota, there's about 130 plus licensed respiratory therapists, and in the United States, over 130,000. That's compared to over 5 million nurses in the United States. That's not to say that we don't need about 5 million of us, but we're very small, but we're needed in a lot of areas. So when you look at places like Aberdeen, Sioux Falls, Rapid City, for example, people up in Aberdeen that are working may have to cross the border, which is only 45 miles up into North Dakota. Also shortly across over by Millbank, if you work in Millbank, you're going over to Minnesota. If you're down in Sioux Falls, you're having to provide care in Iowa, Minnesota, Nebraska, as well as South Dakota. And in Rapid City, the same with the states that are over there. So to obtain all the state licenses with such a small factor of us is really kind of difficult, but we're used to doing that, and so we kind of push through that. Despite the need, current licensing requirements limit respiratory therapists' ability to practice across those straight lines without duplicate applications, fees, and delays. My personal experience is I worked a certified asthma educator, and the South Dakota Asthma Camp used to be held in Lake Okoboji in Iowa. It was chosen in Iowa for the South Dakota Asthma Camp simply because when you have children with asthma, they have to be in a very specific camp that has air conditioning. It has to have certain the facilities have to be provided that are okay for kids that have asthma. They can't be in damp places without air conditioning. You know, it just has to be the right facility. Lake Okoboji had an excellent place where we had to take children. So from Aberdeen, we would take a busload of children down there, and I had to obtain my Iowa license and maintain all the CEUs and everything for it for 5 days a year to practice in Iowa, which we gladly did because the kids were worth it and we had no problem doing that. But it's just the silliness of that. Nurses kind of have the compact licensure. They did not have to do that, and they looked at us like we were nuts that we had to get another license, but we were happy to do that because that's just what we need to do. HB 1148 is a common sense bipartisan policy that will improve access to respiratory care for patients across South Dakota, support healthcare facilities and rural providers struggling to maintain adequate staffing, enhance the state's ability to respond to public health demands without compromising professional standards or patient safety. For these reasons, South Dakota Society of Respiratory Care and our practicing respiratory therapists respectfully urge the committee to support and advance HB 1148. Thank you for your commitment to improving healthcare access and for your leadership on this important issue.
Okay, thank you. Any other proponent testimony in the room? I see we have,
Yes. Online.
yes, online. And please be brief. Try not to repeat anything that's been said. Go ahead and introduce yourself and begin your testimony.
Yeah, so my name is Miriam O'Day, and I'm Senior Vice President of Government Affairs for the American Association for Respiratory Care. And I'm here in support of the compact. I have submitted my testimony online, which you have access to, and I'm here to answer any questions that you may have about the compact. I'll make a couple of notes. One is that this legislation was developed in concert with the Council of State Governments and the Department of Defense, now the Department of War. Our concern about portability, you've heard all of those concerns today, but what you should know is this is a best practices compact, and it is triggered, the next step is triggered when we have 7 states who have joined the compact. We currently have 5 states who have passed, 13 states, including South Dakota, that have legislation in play. The next step is to establish a commission, and that commission will set the rules and regulations, and each state will have the opportunity to name a commissioner to the compact. We hope that South Dakota will be among the founding 7 states. And again, I'm happy to answer any questions you may have.
Okay, thank you. Do we have any other proponent testimony online, I think? No? Okay. Okay, seeing none, I guess we would move to opponent testimony. We have no opponent testimony, so there's no need for rebuttal. I'd open it up to committee questions. If there are. We've seen a lot of compacts. So probably all this. So we'll close questioning and open it up to committee action and/or discussion.
Mr. Chair,
Senator Smith.
I move to pass House Bill 1148.
So Senator Smith moves do pass on House Bill 1148, seconded by Senator Reed. Any comments on your motion?
I think you said it well. We've been through these with different parts of this system, and this just continues the good work. Thank you.
Thank you. Any other comments? Okay, seeing none. The motion before us is due pass by Senator Smith on House Bill 1148, seconded by Senator Reed. All those in favor will say aye, opposed nay. Secretary, please call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith.
Aye.
Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Thank you. So House Bill 1148 has due pass motions. Bill will move to the floor. I was thinking about the next one already, so it'll move to the floor. Any objection to consent? So we'll certify House Bill 1148 for consent. So we'll move on here to, oh, that was my timer on the previous bill. So we'll move on to 1149, adopt the athletic trainer licensure compact. Do you have any proponent testimony?
Good morning, Mr. Chair, members of the committee. Senator Sidney Davis, District 17. We have another licensure compact for you, this time for athletic trainers. Similar to other healthcare licensure compacts that we have seen, this would streamline a pathway for athletic trainers who hold active licenses within our state to obtain a multi-state license in participating states. Athletic trainers, for those that don't know, played a critical role in injury prevention, rehab, and protecting the health and safety of student athletes and active individuals across our state, especially in rural areas. Increasing professional mobility helps ensure our schools, our communities, and our healthcare facilities have access to qualified professionals when they need them. In some of our communities, this might be one of the only healthcare providers that they really have, to be honest with you. And so, like our other compacts, this legislation does not change their scope of practice or reduce any regulatory authority. Athletic trainers remain fully bound by the laws and oversight of our state and the state in which they are providing care. And so this simply just removes and reduces redundant administrative hurdles and supports licensure portability. And so with that, I will stand by for questions and ask for your support.
Yeah, thank you. Do you have any other proponent testimony? Good morning.
Good morning. Cassie Deffenbaugh, Department of Health. We rise in support of this bill as well. We support strengthening workforce and increasing access. And I should mention for this bill as well as the last one that the Board of Medicine also reviewed and is in support of this. Thank you.
Okay, thank you. Do we have any other proponent testimony? Good morning again.
Good morning, Mr. Chair, members of the committee. Tim Rave, Sadaho. I rise in support of the bill. Stand by for questions. Thank you.
Okay, thank you. Do we have any other proponent testimony in the room? I believe we have Lisa Zwart online.
Yes, good morning.
Go ahead.
Chair
Go ahead and
Jensen.
introduce yourself and
Yeah,
begin.
Can you hear me?
Yes, but try to, please keep it brief. Thank you.
Yep. My name is Mary Beth Swart. I'm from Coleman, South Dakota, and I'm employed as a clinical associate professor by South Dakota State University. I'm here this morning in my individual capacity as president of the South Dakota Athletic Trainers Association. I'm a certified athletic trainer licensed to practice in South Dakota. I have not been authorized to testify to this bill on behalf of the South Dakota Board of Regents or South Dakota State University, and my remarks reflect my own professional judgment. I ask for your support of House Bill 1149 to enact the Athletic Trainer Compact and to establish licensure mobility. And that will strengthen public protection, expand access to qualified healthcare professionals, and modernize regulations that reflect today's workforce realities. And so I ask for your support of 1149. Thank you.
Thank you very much. Any other proponent testimony? Okay, seeing none. Do we have any opponent testimony? Okay, no need for rebuttal. Any questions from the committee? Seeing none, open it up to committee action or discussion.
Mr. Chairman, okay, you can go with either one. We might be saying the exact same thing.
Okay, Senator Perry.
I would make a motion that we do pass.
Okay, Senator Perry moves do pass on House Bill 1149, seconded by Senator Voigt. Any comments on your motion?
The senator explained this very well. It's another great step in the right direction. Trainer licensure is very important. The compact's going to be great.
I also know that more and more teams are having trainers that travel with them, and we cross state lines all the time when you're on that bus with that team, especially, certain sports, and they travel all over the region. This is good.
Okay, thank you. So Senator Perry moves House Bill 1149 do pass, seconded by Senator Voigt. All those in favor say aye, opposed nay. Secretary, please call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
Aye.
Smith. Voigt.
Aye.
Davis.
Aye.
Jensen.
Aye.
Mr. Chair, we have 7 yeas.
Thank you. So House Bill 1149 passes with a do pass motion. Would move to the floor. Is there any objection to consent? We didn't think so, so we will certify House Bill 1149 for consent. Thank you. So we're going to move on to the next bill, House Bill 1160, repeal the Medical Marijuana Oversight Committee. Do we have any proponent testimony? And we'll try to get through this bill. If it gets to be too long, we might have to defer final action until after the floor. So.
Good morning, members of the committee. Representative Tim Goodwin, District 30. And it's up to you, Mr. Chair. We could get through if we want to. Appreciate you having us before this morning. This is kind of a unique situation where we actually have a bill where we're going to try to eliminate something. When I first came to the legislature, I was really had an idealistic view of how things were going to be, and I was going to propose that every bill we passed, we had to eliminate too. Well, how successful I've been on that one? Not very good. But House Bill 1160 is Act to repeal the Medical Marijuana Oversight Committee. I was on the summer studies when we tried to get medical marijuana through. Some of the committee members were as well. We worked hard on that. Everybody thought it was a ruse to get recreational marijuana in, which I think we proved that that wasn't the case. And we implemented a very successful medical marijuana program. And at the time, we needed to have an oversight committee because this was new territory for us. It's new territory for most of the nation. We're one of the first to come on board with that. And so I think it was necessary in its time. It's lived out its life. So I think it's time to disband the committee and move forward. So thank you very much. I'll stand by for further testimony or further questions and a brief rebuttal if needed.
Thank you. All right. Other proponent testimony?
Morning, Mr. Chairman, members of the committee. My name is Mitch Richter, and I represent Genesis Farms on this issue. This bill is straightforward. It repeals the Medical Marijuana Oversight Committee. Let me be clear about what this bill does not do. It does not repeal medical cannabis. It does not restrict patient access. It does not weaken enforcement, and it does not change the underlying regulatory framework. What it does is streamline government. The Oversight Committee was created during the early implementation phase by the medical cannabis program. At that time, it made sense. The state was standing up new regulatory systems, issuing licenses, establishing rules, and navigating unknowns. We now are 5 years later, and that phase is complete. Today, the program is fully operational. The Department of Health has rulemaking authority. Enforcement authority already exists. Regulatory safeguards are in place. The legislature retains full budget and statutory oversight. The Oversight Committee is advisory only. It does not regulate, it does not enforce, it does not make binding decisions. It makes recommendations that ultimately return to this body and to executive agencies for action. It doesn't have the authority to propose legislation. In effect, we now have a layer of oversight overseeing a system that is already overseen. This bill recognizes that redundancy and removes it. If at any point the legislature believes the program requires review, we have interim committees, we have standing committees such as this one, we have the authority to request reports, hold hearings, and amend statute. That power does not disappear with this repeal. This measure is about efficiency and consistency. We do not maintain permanent standalone oversight committees for every regulated program in state government. Medical cannabis should be treated the same way as other regulated industries. The LRC likely spent as much time on this committee as it did on the property tax force this past summer. The physical expense for the committee to meet can be saved, as well as the time spent by the LRC and the Department of Health on the 3 meetings that the Oversight Committee had. This program is functioning. The regulatory structure exists. Oversight remains intact through the normal legislative channels. This bill simply eliminates an extra layer that has outlived its original purpose. I respectfully ask for your support.
Okay, thank you. Do we have any other proponent testimony? Okay, seeing none, we'll move to opponent testimony. And I know we have one online, but we'll get to that one after in-room testimony. Good morning.
Good morning, Mr. Chair and Senators. Representative Garcia, District 5. I'm here as a opponent to this bill, one being the committee chairwoman, but also an advocate for the people in the medicinal cannabis program. So as you are getting this paperwork here, I just want to be quick and to the point. The Medical Marijuana Oversight Committee actually is just getting started, I believe, in my humble opinion. I highlighted 7 areas of what the Oversight Committee responsibility is, and that's paperwork you have. I also have given you the committee action of what we found when we did this committee over 3 course of 3 meetings. And I know that there will be other opponents that will get up and just testify, but if we had not done what we did this summer, we would not have passed the SB 90 bill, which is the prescription drug monitoring, wanting the 3 criteria that you all passed in this committee. I would not have compromised my bill, the HB 1211, which is the digital application bill, and you have a letter of intent by the Department of Health that was never implemented in 2020. Perhaps we didn't have the software, but now with all the good software, we are able to do this. Unfortunately, there's no actual date. It just says it will be going forward. They'll get contracts. So those 2 things I want to highlight did come out of this committee, which was extremely important for the safety of the people. I also want to point out that in the actual area of the committee action, we have found many areas where fines are being just there's random fines for simple things in these actual dispensaries, which we have not rectified. The thought of possibly telehealth was another option that we came and identified that could be useful in the safety of the patients, providing the objective of proper facilitation of the medicinal cannabis to the patients. We also have not determined actually the mental psychosis we're now seeing with the cannabis use. things that are being discussed are stress, anxiety, PTSD, which is not an indication for this type of cannabis use, and it has actually potentiated the mental psychosis. So I'll just end with this, that the main goal of the Medical Marijuana Oversight Committee is to ensure that medical cannabis program operates safely, legally, ethically, based on medicine, evidence-based medicine, and in the best interest of the patient. Thank you. I'll stand by for questions.
Okay, thank you. Any other opponent testimony? Good morning.
Good morning, Mr. Chairman, members of the committee. I'm Michael Pauley, Executive Director of the South Dakota Catholic Conference. I'm going to speak kind of quickly today because I know we have a lot of people who want to testify. Over the last several years, we've seen various legislators propose modest changes for how our medical marijuana program is administered or regulated. And frequently, these proposals have triggered protests from representatives of the marijuana industry that legislators are undermining the will of the people. How often have we been reminded that nearly 70% of South Dakota voters supported initiated Measure 26 in the 2020 election, which ushered in the medical marijuana program we have today. So I find it ironic that today we hear representatives of the marijuana industry testifying in favor of House Bill 1160 when this bill actually slashes from our statutes some of the language that voters supported in 2020. The existence of the Oversight Committee was mandated by initiated Measure 26. That's why it exists. Look at Section 1 of the bill. The text you see deleted in lines 4 through 5 comes from Section 92 of Measure 26. If you look at Section 3 of the bill, the deleted text there comes from Section 93 of Measure 26. And when this measure was presented to voters, we were told it would be a quote-unquote well-regulated program. Those were the exact words from the official statement for Measure 26 from the Secretary of State's ballot measure pamphlet. Our position would be that the Oversight Committee is an essential component of a well-regulated program. Now, the marijuana industry testified today that we don't need this committee anymore. They say its work is done. But again, when Measure 26 was drafted, there was no sunset provision included for the Oversight Committee. They could have added one, but they didn't. So why is that? And I think the answer is quite clear when you look at the stated purposes of the Oversight Committee. These purposes are not short-term tasks associated with standing up the program. Rather, they're ongoing responsibilities. For example, the second stated purpose of the committee, you can see this in Section 3 of the bill before you today. The Oversight Committee is tasked with evaluating, quote, the reasonableness of prices charged by marijuana dispensaries. That's obviously not a one-and-done kind of task. Prices are a moving target. They change from month to month, from year to year. Or consider item number 6 on the list of responsibilities. The Oversight Committee is to make recommendations to the legislature and the Department of Health regarding, quote, any research studies regarding health effects of medical cannabis for patients. Now let's think about this. Medical studies about the health effects of marijuana are coming out all the time. It's the committee's responsibility to evaluate the latest research as it comes forth and see if it warrants any changes in the program. And again, this is not a kind of one and done sort of goal. The proponents of this measure are telling you the Department of Health can handle everything. But again, if you look at the way Measure 26 was worded, the Oversight Committee was clearly intended to play somewhat of a watchdog role over the Department of Health. You can see that, for example, in the 4th stated purpose. It says the Oversight Committee is to evaluate and make recommendations on the following, and I quote, the sufficiency of the regulatory and security safeguards contained in this chapter and adopted by the department to ensure that access to and use of cannabis cultivated is provided only to cardholders. In other words, the clear purpose of the committee is to be a third-party entity that evaluates whether the Department of Health is actually properly regulating the program, to make sure that marijuana is only accessible to those who have a legitimate need for it. In conclusion, I'll just note that the same voters of South Dakota who approved medical marijuana in 2020 voted to reject recreational marijuana in 2022 and 2024. We believe there needs to be a clear, bright line drawn between medicinal use and recreational use of this drug. That serves the interest of public health. It's what the voters asked for, and the Oversight Committee plays a vital role in carrying out this mandate. We respectfully ask you to reject House Bill 1160. Thank you for your time.
Okay, thank you. Do you have any other opponent testimony? Good morning.
Good morning, Mr. Chair, members of the committee. Lisa Gennaro with Protecting South Dakota Kids. This committee that is brought together is a balanced group of people. It's 2 state senators, 2 state representatives, a doctor, a physician assistant, a nurse practitioner, a police chief or officer, a sheriff or deputy, a counselor or an addiction specialist, and 1 patient who uses medical cannabis. They talk to real patients, caregivers, pharmacists, school leaders, parents, police, and the Department of Health and others before making suggestions. The committee is low cost and does exactly what voters wanted. Keep an eye on the program so it works for the patients without problems. In response to a question raised in prior hearings about expenses, legislators receive standard interim per diem. This doesn't cost us a lot for them to meet. Approximately $157 to $178 per day plus mileage, if applicable. And non-legislator members receive state per diem rates for advisory boards, typically around about $166 per day for meals, lodging, if needed. With only 3 meetings in 2025, the total state spending on compensation and expense is minimal, likely under $7,000 annually. So to keep this committee going, out of everything that the state covers, keeping under $7,000 for 3 meetings in a year, I think is something that is very important that we keep this committee going, just because obviously it's what the people wanted also. Thank you. Please vote no.
Thank you. Do we have any other opponent testimony?
Good morning.
Good morning.
Mr. Chair, Senator John Carley, District 29. Thanks for meeting today at the committee. I did serve on the Medical Marijuana Oversight Committee along with another senator and 2 other representatives. And we had a good committee. We heard who was on the committee. Just to quickly clear up some misinformation from a proponent, I heard a comment that it was equal to the Property Tax Committee's meeting this summer in cost and extent. We had 3 meetings this summer. But the Property Tax Committee not only had 3 meetings, they had 4 meetings, 5 meetings, 6 meetings, 7 meetings, and 8 meetings. And they did that all over the state. We ended up having our meetings just here, those 3 meetings here. So it's not even close to comparison. It was much less cost being in this building. Let's see. I'll just mention that the executive board of the legislature is the one who puts this committee together. We appreciate that executive board, and they pick the members every 2 years and assign that committee just like they do other committees. We have a lot of people on this. I think the issue here is we need to be cautious that repealing this committee may very well lead towards recreational marijuana, and I want us to be careful about that. This is a good committee. It's the only representation of the people to look over this from the legislature. We have an executive branch that works on a part of this. We have the marijuana businesses that work on this, but this is the legislature. This is a branch that represents the people that gets to look over that. Removing oversight is not wise. Don't give away any of our legislative sovereignty. And I'd ask that legislative oversight is good. So I'd ask that you please send this bill to the 41st day. Thank you.
Thank you. Do you have any other opponent testimony?
Good morning, Mr. Chair. Good morning, committee members. Lauren Nelson, State Senator, District 18. Yeah, I came into this medical marijuana committee. I was one of the senators on this. I came into this knowing nothing and was wondering why I got put on it. But one thing I can tell you, I enjoyed it. I learned a lot, and I enjoyed the diverse makeup of it, of the different members. And Ms. Casey that sat beside me taught me a lot, and I learned a lot. Why do we need to keep this committee? First of all, one thing that was very apparent, and again, coming into this not having much background with medical marijuana, is the fact that it's kind of in this mush world or this quasi world, because again, it's illegal federally, but now in the state it's legal. it's medical, but when you start talking about controlling it medically, no, it's natural. And then when you say, well, let's control it naturally, then it's like, well, it's medical. And so there's this weird world that recreational marijuana is in. And I think the thing about it is that this committee is needed just because of that fact. And I think once, there's talk of it marijuana being rescheduled, I think at that point, let's talk about getting rid of it because of the fact that you'll have other safeguards. But right now, there's just this quasi land that we are in. The other thing that really shocked me, the first meeting, and again, you can go back and listen, how many times it was reported repeatedly, oh, we need recreational. This medical, we got it coming in from Minnesota, we got to get recreational here. Otherwise, we're not going to make any money. I was astonished with that, how many people had said that. And it kind of, I took it back. I'm like, what's going on here? We defeated that. What's going on with this? We need to make sure that medical marijuana, what the people of South Dakota wanted, is protected. And I think by the time we got to that third meeting, we were back into the guardrails. We were back into the alley that we were supposed to be in. And so we need to, this committee, I think, did a really good job this summer of getting the focus back to what the people of South Dakota wanted, and that is medical marijuana. Also, too, this committee brings transparency. I think Representative Garcia had mentioned the many things that came out of this committee this summer, and the things that people were able to come forward with, and things that they had issues with the program, and we were able to talk about them. And some of this legislation this year came about with that. So with that, I just want to say I see the value in this committee. And again, as a person who's brand new to it this year, I definitely see the value in keeping this committee going. Thank you.
Thank you. Any other opponent testimony? Good morning. Good morning.
Good morning, Chairman, committee members. Stacy Ackerman, Executive Director for the South Dakota Sheriff's Association. We rise in opposition today of House Bill 1160. We have had 2 sheriffs who have sat on the Medical Marijuana Oversight Council. Previously, it was Pennington County Sheriff Brian Mueller, and currently we have Meade County Sheriff Pat West on the council. As I understand it, Sheriff West did submit emails or written testimony to all of you. But I just want to make a few comments. As South Dakota continues to navigate the implementation and regulation of medical marijuana, the Oversight Committee plays a critical role in ensuring accountability, transparency, and public safety. Medical marijuana policy is still evolving. Eliminating the Oversight Council removes a critical communication link between regulators, public health, and those of us tasked with enforcing the laws. Thank you.
Thank you. Any other opponent testimony? I think we have one online. Rhonda Milstead, are you online? Go ahead. We kind of are up against the clock, but go ahead and give your testimony.
I am. Can you hear me, Senator?
Yes, we can hear you fine.
Okay. So Rhonda Milstead, and I am representing myself. And I want to just thank you for hearing my opposition to House Bill 1160. I think that there's a huge red flag here that should concern all of you very seriously. And the reason being that this bill is here before you because of an expressed firm desire at the last meeting this summer by the industry to repeal oversight. And, with just briefly, with the increasing number of research studies becoming available and the risks of abuse this drug holds, as well as the dangers that are still unknown, now, if ever, is not the time to abandon the due diligence of the Medical Marijuana Oversight Committee. It offers safety to patients and the public. The job of this oversight committee is far from done, and the people of South Dakota deserve the attention of a balanced, knowledge-seeking group to be sure cannabis is used safely when deemed necessary, as well as ensuring our children and our grandchildren are not subjected to the dangers of illicit drugs caused by weak regulations. I urge you to vote no on House Bill 1160, and thank you.
Thank you. With that, I don't think we have any other opponent testimony in the room, so we would move to rebuttal.
Mr. Chair, Representative Tim Goodwin, District 30. Well, I think we've had a fair hearing here today. Maybe a little long, but I think we had a fair hearing. Just a couple things that it's not. We're not trying to sneak in recreational marijuana. We fought when we had the summer studies. That's what everybody thought was going to happen. It was just a ruse to get recreational marijuana. There's no way, no how that's going to happen. And we have Department of Health that can manage this. We just think this committee, we thank the committee for the work they've did, for the oversight they did. There is no knock or anything said derogatory to the committee. It's just time to end it and move on. So I appreciate your support in this endeavor. Thank you.
Okay, thank you. With that, I'll open it up to committee questions. Okay, seeing no questions, Senator Davis.
Mr. Chair, for the prime sponsor, can you speak to what kind of work the committee did in the early years versus now? I mean, do you recall like the workload that the original committee did versus, in those early years versus now?
I'd have to look at the minutes to give you an accurate information on that, versus then versus now. But I think the committee did a great job. I mean, there's nothing that we said that they were irresponsible or that they weren't doing what they were meant to do, but it's just time to end the committee.
Mr. Chair.
Okay, go ahead.
I don't know who this question is for. Maybe Mr. Pauly. I'll just ask the question and you can decide. Is that okay, Mr.?
Right.
So in the measure, initiated measure 26, just a simple Google search, it states that the creation of a medical marijuana oversight committee was a core component of the initiated measure, which you brought that out a moment ago. I'm just wondering was that a part of what we voted on? Was that in that when we said, yes, we want this? I filled in that dot and said, yes, I want that. Was that in there? And if it was, what does that do from a legal perspective if we were to end this committee? I don't know. The public voted for it. So I guess I'm just wondering, what does that do?
Mr. Chairman, Senator Grove, yes. So, and I think I mentioned this in my remarks, but I was speaking really fast. So the initiated measure 26 had just dozens and dozens of sections. It was a really, really long initiated measure. And the creation of the oversight committee is in section 92 of the measure that appeared before voters. And I have it in front of me here. It says the executive board of the Legislative Research Council shall appoint an oversight committee, and then goes on to talk about the composition of that committee. And then the next section, section 93, is the one that lays out the responsibilities of the committee. And talk about it's everything from monitoring cannabis testing facilities, whether a sufficient number of them are operating. The first goal is the ability of qualifying patients in all areas of the state to obtain timely access to high quality medical cannabis. That's the number one goal. And again, not to repeat myself, but I don't see these as sort of like one and done goals. These are sort of ongoing things that would require a continuing committee. Did that answer your question, Senator?
It does. It does answer my question, but I do have one more. Very quickly for Rhonda Milstead online.
Rhonda, are you still online and available?
Yep, I am. Thank you.
Okay, go ahead. We have a question for you.
Did you hear my last question? And I'm just wondering if you remember that as well, if you have any thoughts.
Rhonda Milstead, again, and are you referring to what was in IM 26? Is that the question?
Correct.
I'm going to stick with what Mr. Pauly said. I haven't looked back at that, but yes, all of that came from the initiated measure that people voted on. It was in the language. So why are we trying to eliminate it now?
Thank you.
Okay, thank you. With that, we'll close questioning, and I'm going to a little historical perspective before we start our discussion. Trying to figure out how to say this quickly, but the Medical Oversight Committee was actually part of, it was Section 92 of the bill to create the medical marijuana program. But as testified in this committee by their lawyer, Jeremiah Murphy, the committee was originally set up to protect the industry. It was set up, let that sink in. It was set up to protect the industry. And a couple years in, Senator Duhamel, thank you for being here, Senator Duhamel and I ran a bill to change it to make sure that it was to protect the people, that the council makeup was changed to what we see today, the people on the committee, to protect the consumer, not to protect the industry. So what we have right now is a Consumer Protection Council, and I just want to make sure everybody's aware of that, because some people, new people here don't know all that transpired. So with that, I would open it up to any commissioner discussion or action. Senator Reed.
Thank you, Mr. Chair. Well, I was, in the legislature when this was first passed, and the committee, I think this kind of goes to Senator Davis's question, the committee had a lot of work to rework the laws or the initiated measure. And, it had to, it was, the people voted for medical marijuana. And we had the job of going through it and saying, okay, we heard you. Now we have to make this in a workable format. And I remember this committee bringing forward quite a few recommendations over the years. And the first one was almost a complete, I don't want to say rework, but really going through it to make sure that it worked within our laws, because it was wrote by an outside entity. That's the problem of initiated measures. And so we had to take it, but we had to really balance it, that we're not trying to stop it because the people did vote it in, but yet we had to put regulations into it. And so that committee at that time, was working through all that, and I do think it was an important committee at that time. And I'll leave the rest of my comments for when we decide on the motion.
Okay, thank you. Any other comments? Senator Perry.
I worked on the medical marijuana task force when we did the summer study and all that. And this group that just presented today, I understand the opponent and I also understand the proponent, but the important thing here is the committee members are the ones that are saying our job isn't done yet. And when your committee members are saying our job isn't done yet, maybe the rest of us know a lot, but maybe we don't know as much as the people that are actually having their feet on the ground. So I'm leaning toward supporting the committee.
Okay. Any other, not quite sure how that ended, but any other comments from the committee or discussion or action?
Mr. Chair.
Senator Grove.
I'd make a motion to send to the 41st day.
Senator Grove moves 41st day. Can I get a second?
Second.
Senator Voigt seconds. Any comments on your motion?
I guess the thing that's kind of reverberating through my head is, yikes, I'm not going to touch what the people voted on. That's been my stance this entire time, is to stand and make sure that medicinal marijuana was protected. And they voted, myself included, because this board was there. And I felt like it was a protection. And I am certainly not going to now vote to kill it. I think that if we want it removed, I think that would have to be for the people to vote on again. So I think we should stand firm with how they voted.
Mr. Chair.
Senator Smith.
I'm going to resist this motion. First of all, we've to say that people don't vote against initiated measures. I mean, we totally dismantled IM-22. We sued ourselves on having recreational marijuana, which passed at the same time that the medical passed. I mean, the will of the people is subverted all the time in this building. But here we do have a committee that was set up to be a committee to do what it did. And I believe it established a very good program. and I think it's working. But if it has outlived its course, and that's to be debated right now, I think that's the debatable issue: is has this committee outlived its usefulness in the format that it is? And so I think that's what we're voting on today. I don't think we're subverting the will of the people. The will of the people was to have medical marijuana system set up in the state, and we've done that. And we are, and it's working, and it keeps getting better. And we know that even without laws being brought forth, the Department of Health is working on even making it better with some of the electronic, cards and things like that. And they're doing that on their own accord, without this committee saying that this is what they should do. They've said that they're bringing forth those opportunities. And so I'm going to resist this motion.
Senator Reed.
Thank you, Mr. Chair. I'm also going to ask that you resist this motion. And the points that I had started making in our discussion is this has continued to evolve. And I don't think we've ever subverted the will of the people to have medical cannabis. But we've always had to look at different aspects of it as the legislature. And I think that that we will continue. This probably will never stop because there's going to be changes all the time. But I do believe that once you stand up the program, and which was a lot of work, there was a lot of work that was done, then it needs to move more into a regulatory type than an oversight committee. And these oversight committees especially get really tough as operating as a legislature when you have to pull in a lot of people from outside the legislature. That can be a difficult thing to work through and takes a lot of LRC resources. Because who does LRC work for? They work for the legislators. Well, then all of a sudden we put a committee together. Well, do they work for those committee members? That's a question that's always out there when it comes to these type of committees. And so for those reasons, I do think it's time that we move on from this committee and we just continue to let the program evolve and change as we find out year by year. So please resist the motion.
Mr. Chair, I'll
Thank
be
you,
brief.
Senator Davis.
I'll be brief. Having been around throughout this committee's entire lifetime, the original committee work, they brought forth like at least 20-some proposals. I mean, because the workload was immense. And so, now that we're seeing committee work dwindle, I just think that's an indication that we do have a good hold on this program and that we do have adequate reporting and oversight. The Oversight Committee itself doesn't have any legislative authority. We have 105 legislators that are still addressing issues like we do every other issue in this body and every other issue that affects our constituents and healthcare regulation and all of that. That doesn't change. We still have the ability to do all that. We still have a department that is monitoring and regulating it and reports to the health committees. We still have a lot of oversight and communication and transparency. And so for those reasons, I'm going to be resisting the 41st day motion.
I will support the motion, and here's why. Medical marijuana is still illegal federally. I don't care if the president said he's going to try and move it to Schedule 3. It has not, and it'll take years for that to happen. It's still illegal federally. If you think about it, the reason we have a third party running the medical marijuana registry is because the Department of Health couldn't do it because it's illegal federally. So the only way to really have so we're asking the Department of Health to have regulatory authority over an illegal product. I think that's a huge mistake. Honestly, I think it's a huge mistake. The Oversight Council has the authority to keep looking at all of the changing laws and changing rules and bring those forward. Do we expect the department? Yeah, this year we had 104 agency bills. But can an agency bring forward a bill to support an illegal product? I really question that. So I'm really going to ask you to think hard about what we're doing here and support this motion. Thank you. Any other comments? Thank you. With that, we have a motion on House Bill 1160, 41st day by Senator Grove, seconded by Senator Voigt. I'll ask the Secretary to call the roll.
Senator Grove.
Aye.
Perry.
Aye.
Reed.
No.
Smith.
No.
Voigt.
Aye.
Davis,
No.
Jensen.
Aye.
Mr. Chair, we have 4 yeas and 3 nays.
Thank you. So House Bill 1160 will move to the 41st day. I will have a motion to adjourn. Senator Perry, Senator Voigt seconds. All those in favor say aye. Opposed, nay. Thank you. We got a lot of bills done today. Appreciate it.
SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts Programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder.
I'll call to order Senate Local Government. I'd like to welcome everybody today for our, what I hope to be our last meeting. I'd like to greet all the internet listeners and those that are watching it. Just a reminder for everybody, please check that your cell phones are either off or on silent mode. And I'll ask for the secretary to please call the roll.
Senators Nelson? Excused. Roll?
Here.
Shanefish?
Here.
Smith?
Here.
Whip?
Here.
Hamel?
Here.
Reed?
Here.
Mr. Chair, we do have a quorum.
Thank you, Madam Secretary. And I would like to move on to approval of the minutes from our last meeting. Do I have a motion to approve last meeting's minutes?
So moved.
I have a motion by Senator Duhamel, second by Senator Roll. Comments on your motion? All those in favor of the approval of the minutes will say aye. Aye. Opposed? The minutes are approved. I'd like to remind all the testifiers to sign in. I think we're late enough in the season, we don't have to talk about the new system anymore. But if you do have an issue, we have our pages here that can hand out or can help you with it. Remember to sign, I talked about signing in, but lobbyists, please be wearing your badges. And all testifiers remind all testifiers that handouts are to be distributed by pages. And I think our pages has left the room, and this is usually where we introduce them. Yeah, that's okay. When they're back in, and don't be afraid to remind me that we have to do that. We'll make sure we get them introduced. So, are there any personal privileges from committee members? Seeing none, we'll move on to our first bill, and we're going to take House Bill 1320 first. And I want to let everybody know there is an amendment out there, so you get a little time to call it up so you can look at it. And so we will start with House Bill 1320 before returning to the regular order. And this is a bill to revise a provision related to service of process for boards of county commissioners. And I'll ask for proponent testimony.
Thank you, Mr. Chair, members of the committee. If you've had a chance to look at the amendment, this was in working with those who were soft opponents last time. But we kind of got all the bugs worked out. And again, the idea of Representative Tony Randolph, District 35.
And let's just go ahead and move the amendment.
Yes.
So you'd like the amendment moved?
I would like the amendment moved,
and that's
yes.
1320?
So moved.
Okay, so we have Amendment 1320 moved by Senator Smith. I need a second. Second by Senator Duhamel. Any comments on putting the amendment on? Senator Smith?
It'd be Amendment D, correct?
Yes, I'm sorry, Amendment D. Yes, this is Amendment D. So the motion before us is to amend with 1320D. Senator Smith, comments on your motion?
The only comments are that this is what we were hoping was going to happen when we deferred action.
Great. Sounds. Any other comments? With that, all those in favor of Amendment 1320D will say aye. Aye. Opposed? Okay, so Amendment 1320 passes, and please speak to the bill as amended.
Okay, Representative Tony Randolph, District 35. I apologize. I'm juggling several things, and so I came in like a rush, and I needed to slow down for a second. And so first things first. First, thank you for passing the amendment, and thank you for giving me opportunity to actually work with those to get this right. The idea is absolutely to make it for the citizens as easy as possible for the citizens to be able to serve a notice of appeal. And this does that. And so as you can see in the amendment, it changes things up a little bit. Before we had treasurer and some, as I spoke before, there was one county that has an executive, but none of the rest of the counties really do have any of those titles. So this tightens it back up and allows it to be general across the whole state and apply to everyone. So again, thank you for your time, and thanks for working with me on this.
Thank you, Representative. Is there any further proponent testimony? Proponent testimony.
Good morning, Mr. Chair, committee members. My name is Holly Hennies. I serve as the Deputy Director for the South Dakota Association of County Commissioners. First of all, I just want to quickly say that we very much appreciate Representative Randolph and what his intent with the bill is and working with us. We are no longer softly opposed, and we definitely support his intent and the changes that the amendments have made. Thank you.
Thank you. Further proponent testimony on House Bill 1320 amended? Seeing none, we'll move on to opponent testimony. Is there any opponent testimony? Seeing none, I'll waive rebuttal, and we'll move to committee questions. Seeing none, we'll move on to discussion and/or action.
Mr. Chair.
Senator Duhamel.
Thank you, Mr. Chair. I would move do pass.
Second.
We have a do pass motion on House Bill 1320 as amended, made by Senator Duhamel, seconded by Senator Roll. Comments on your motion?
Love when these compromise work out and everybody gets a little bit better bill.
Further comments?
Yeah, I guess I'll echo that. Just, good job to the sponsor, working with opponents to make things work. I think that's how we just make better policy.
Further comments? Seeing none, we have a do pass motion on House Bill 1320 as amended, made by Senator Duhamel, seconded by Senator Roll. Those in favor will vote aye. Those opposed, nay. Madam Secretary, please call the roll.
Senators Nelson,
Aye.
Roll,
Aye.
Shanefish,
Aye.
Smith,
Aye.
Whiff,
Aye.
Duhamel,
Aye.
Reed.
Aye.
Mr. Chair, we have all yeas.
Thank you, Madam Chair. House Bill 1320 will go to the floor as a do pass motion as amended. And I think we can do this on consent. I don't think we've had really that strong of a do the process, especially here. So unless there's any, I will certify it as consent. We will now move on to House Bill 1161. This is to amend provisions related to changing rooms, sleeping quarters, and restrooms. Asking for proponent testimony. Welcome, Senator.
Thank you, Mr. Chair, members of the committee. Got to give you a little bit of history lesson here, going back a year. A year ago, we passed House Bill 1259, which is better known as the high school bathroom bill, and it passed. I supported that, as many of you did. But tucked back in the, further back in the language of that bill, back on the third or fourth page, starting with maybe section 7, 8, 9, kind of a situation, something came up, kind of unintended consequences, because not only did it address the issue concerning schools and bathrooms, but also talked about government buildings in general, that we need to be allowing for accommodations for males and females. Well, one of the issues that has come up is I was approached by two different fire chiefs here in the state that, okay, we look at this, some of our fire departments have the big open bay sleeping areas, and okay, what does that mean for in a situation like that? Well, if you look at one section of the bill, it says the sections of this act referring to government-owned buildings do not apply to a law enforcement officer or fire official acting in an official capacity. So it looks like at that point we are okay as far as exempting police and fire departments. Well, I've been approached by 2 different cities' attorneys that say, wait a minute, is a sleeping area, when they're sleeping, in the case of fire department, are they acting in an official capacity? And their opinion was probably not, which means therefore that fire departments are subject to the requirements laid forth in House Bill 1259. So with that as a preference now we look at what's before you today, House Bill 1161, and this specifically makes clear now, I'll direct you to Section 1 and subsection or paragraph 2. It says a space leased to or occupied by the state or political subdivision of this state, and then it says this section does not apply to any room used exclusively by firefighters. Now this is hitting it right on point now, that now we are talking about a sleeping accommodation for firefighters. And then it also says or law enforcement personnel acting in an official capacity. So there you can kind of envision, example that got thrown out was that, okay, Sturgis, for example, they're probably police personnel sleeping in a big open gymnasium, for example. It would not apply because they're also acting in official capacity. So I think this addresses an unintended consequences that the bill 1259 that we passed last year, because we kind of got fixated on the school situation, and that one kind of snuck by us. So I would ask for your consideration of supporting House Bill 1161. Thank you.
Thank you, Senator. Further proponent testimony. Proponent testimony. Welcome. If you'd introduce yourself, please.
Morning, Mr. Chair. My name is Matt McRavy. I'm the Fire Chief for Sioux Falls Fire Rescue, and I'm honored to appear before you this morning to support of House Bill 1161, here representing the city of Sioux Falls. I want to take a moment to thank Representative Cole, Representative Emery, Representative Ladner, and Representative Rowe for supporting this, as well as thank you, Senator Reed and Senator Vilhauer, for supporting this. We greatly appreciate it. This bill comes to you as a strong bipartisan support. It passed the House State Affairs Committee unanimously, 12-0, and it passed the full House floor with a vote of 62-4. I believe that record reflects the clarity and the practicality of what this bill accomplishes. House Bill 1161 seeks a narrow, targeted amendment to address any unintended consequences from last year's House Bill 1259. That was an act that this legislature passed to protect multi-occupancy spaces. However, as written, House Bill 1259 could create significant operational challenges for fire departments whose facilities were built, some of them almost a century ago. Sioux Falls Fire Rescue presently has 6 fire stations with multi-occupancy sleeping quarters. Those stations were built between 1912 and 1989. Under a strict reading of 1259, we would be required to designate those sleeping quarters exclusively for one gender. Given the current gender demographics of our department, that designation would be male, and that would directly limit the station assignment opportunities available to our female firefighters. Station assignment is one of the most meaningful and significant factors in a firefighter's career development. Each station carries a unique crew, unique leadership, specialty response, as well as opportunities for professional growth. Restricting our female firefighters from assignment at half of those stations would impact their careers and frankly would put the city of Sioux Falls at risk of violation for state and federal anti-discrimination laws because we would be treating employees differently based on their gender. The amendments to this bill were carefully crafted in response to feedback that we received from the House State Affairs Committee. What remains is a clean, focused exemption for employees of political subdivisions acting in their official capacity. This is consistent with the constituents around it. I want to be clear, every firefighter in our department is held to a rigorous professional standard. They're subject to indecency laws, and there have been no complaints of impropriety at the fire stations. This bill is about operational clarity, equal opportunity, ensuring that agencies like ours have are able to honor the intent of House Bill 1259 while managing facilities that span more than a century of construction. The House spoke clearly and effectively. I respect that the Senate does the same and pass this bill. Please, I encourage you to vote yes on House Bill 1161. I'll stand by for questions.
Thank you, Chief. Further proponent testimony in the room here? Proponent testimony. Seeing none, we'll move online for proponent testimony. And I think we have Amber Mulder. Are you available?
Yes, I I am here. Thank you, Mr. Chair. Members of the committee, my name is Amber Mulder. I'm a Senior Assistant City Attorney for the City of Sioux Falls. I'm requesting your yes vote on House Bill 1161. While last year's House Bill 1259 encompassed school districts as well as political subdivisions and state agencies, this bill only impacts political subdivisions and state agencies. The requirements and prohibitions placed on schools under last year's bill are not impacted by House Bill 1161. As discussed, this bill seeks an amendment in South Dakota Codified Law 2013 to carve out an exception for changing rooms, restrooms, and sleeping quarters used exclusively by firefighters and law enforcement personnel. While the catch lines for 2013-58 through 63 state that those statutes only apply to changing rooms and sleeping quarters open to the public, there's no such distinction in the text of the statutes, and that's why it's our interpretation that we are subject to those requirements. As Chief McAravey explained, we are struggling to comply with the requirements of House Bill 1259 from last year, since half of our fire stations only have one dedicated sleeping quarters. If we are to fully comply, we'd have to limit assignment at those stations to either males or females. To do that, we would limit opportunities and potential for growth and skill development because there are special assignments specific to the individual stations. And that would put us at odds with state and federal anti-discrimination laws because we would be treating individuals differently based on sex. Further, I just want to make it clear that all firefighters are subject to standards of conduct with respect to professionalism, and they are also subject to indecency laws. There have been no complaints of impropriety at our fire stations. So please vote yes on House Bill 1161, and I will stand by for questions.
Thank you, Ms. Mulder. Is there any further proponent testimony in the room? Seeing none, is there any opponent testimony? Any opponent testimony? Seeing none, I will waive rebuttal, and we'll move on to committee questions. Any committee member have a question? Seeing none, I'll move on to discussion and/or action.
Mr. Chair.
Senator Smith.
I move to pass 1161.
We have a do pass motion made by Senator Smith, seconded by Senator Duhamel on a do pass for House Bill 1161. Comments on your motion?
I really appreciate the diligence being brought forward by our firefighters and by the legislators to make sure that we fix any unintended consequences that were taken care of. A side note, my grandfather was chief of fire prevention in Sioux Falls, and I have fond memories of Central Fire Station, and I believe that's one that has a large open room. And as a kid, I thought that sounded like a lot of fun. But they also had the pole that you got to go down to get to the truck, and that was pretty cool stuff as a kid. But anyway, that's just a side note. Thanks.
Thank you. Further comments on the do pass motion for House Bill 1161? Seeing none, those in favor of the do pass motion on House Bill 1161 will say aye. Those opposed, nay. Madam Secretary, please call the roll.
Senators Nelson? Aye. Roll?
Aye.
Shanefish?
Aye.
Smith? Aye. Whiff?
Aye.
Duhamel?
Aye.
Reed?
Aye.
Mr. Chair, we have all yeas.
With the unanimous support, HB 1261 will go to the floor with a do pass recommendation, and we'll put it on consent unless there's any concern.
1161.
Oh, I'm sorry, 1161. Thank you, 1161. Okay, now we'll move on to House Bill 1245. That's an act to authorize municipalities to establish a local funding mechanism for capital improvement projects. I'll ask for proponent testimony. Welcome, Representative.
Good morning, Greg Jamison, District 12, Sioux Falls. Thank you for this opportunity to talk to you about House Bill 1245. 1245 really is a fiscally conservative approach to capital improvement project funding. It's got 9 sections. Just wanted to go through them real quick with you. There's plenty of others who want to talk about this as well. The first section really is about the appointment of a capital improvement board, how that's structured. Section 2 sets up the terms of those board members. Section 3 says the municipality may, if they choose, create a tax up to 1%. So it's enabling language there. Section 4, if the municipality wants to add a new tax, they must first specify it in an ordinance. And in that ordinance would be the purpose and the minimum amount to be generated. Then they vote. That's the first vote. Second, they submit that ordinance to the Capital Improvement Board that has been created, and then that board must vote to approve it. After that Capital Improvement Board approves it, it then is ordered to go to a municipal election where 60% of the voters, so that's Section 5 requires that 60% of the voters approve the measure. And if approved, the money collected must be put into a special fund, so it's not just added to a general fund, it's into a specific account obligated for that capital improvement project. Section 7 outlines the restrictions for using the money, the types of projects that are allowed. Section 8 specifies the time period, the start and end dates. And then Section 9 requires a 2-year gap between any asks of the municipality. This is a great example of local control, 3 votes and a 60% margin by the public to approve such a project. So it's got quite a high bar, and it asks for your favorable consideration. Thank you.
Thank you, Representative. Further proponent testimony for House Bill 1245. Welcome. Please introduce yourself.
Morning, Mr. Chair, members of the committee. Mike Bockerny, CEO of the Economic Development Professionals Association of South Dakota. I also serve as the registered lobbyist for the Aberdeen Development Corporation and the Aberdeen Chamber. We come to you today with over 3 years spent on crafting this legislation. Why so long? We've been diligent in looking at other states similar to South Dakota who have this program in place. We asked them, what did you do right? Most importantly, what would you change, if anything? We did this to ensure that we would be able to present you with the right legislation that makes sense for our state, and that is what you have before you today. Currently, we are aware of 35 other states allowing a local option sales tax measure such as this. A couple of things that I really want to point out here. This bill allows local citizens to decide their own priorities. Under this model, a locally appointed board identifies and evaluates projects based on the community needs. The proposal must be approved by a public vote at a 60% threshold, ensuring transparency and accountability. The funding mechanism sunsets automatically once the funds are raised, preventing unnecessary long-term taxation. This allows the community to avoid costly interest payments and ensure every dollar is directly reinvested in the community by the citizens of the municipality that chose to do this. This legislation does not mandate new taxes, but it instead allows municipalities the option to refer a proposal to the voter. If a community does not support a proposed project, they retain the power to reject it at the ballot box. This process fosters civic engagement, enhances public trust, and strengthens South Dakota's tradition of local governance. I'd like to point out a couple other very important things that could be very valuable for a community to choose what they invest in this option. I'm going to give you just a few examples, very common that we've seen in other states that this could be used for. It could be used for water enhancements, wastewater, walking or biking trails, recreational parks, county fairground enhancements, cooperative school district buildings, libraries, an arena or a stadium, a community plaza, child care center, community center, EMS facility for fire and ambulance, arts and cultural facilities, sports complexes, a senior center facility, streetscape enhancements, wayfinding signage, public art installation, a youth drop-in center for after-school care, innovation hubs, visitor centers, campground expansions, community theaters, and after-school facilities of various types. Those are just a few of the most common examples that we've seen other states utilize this for. That we feel that this bill is a very fiscally responsible tool that will allow communities to invest in their future while maintaining local control. A couple other things I just want to point out here. This is going to be one of the key points in this whole concept here. Just taking an example here, yes, there could be, one of the tools that exists right now for a municipality is you can bond for a project. However, when you bond, you have to take debt. Then you capitalize interest on it. Just for example here, I'm going to take a $10 million bond You amortize that over 20 years. At a 3% interest rate, over the course of that time, the total interest cost at 3% is approximately $3.5 million. 4%, $4.7 million. 5%, $6 million. So you take a $10 million project, and you have to add that on top of it. And all the citizens end up paying that anyway. This gives another option to the citizens to choose to avoid that debt. We feel this is a very strong bill. We ask for your support. We'll stand by for questions. Thank you.
Thank you. Further proponent testimony for House Bill 1245. Proponent testimony.
Good morning, Mr. Chair, members of the committee. My name is Sarah Rankin, and I'm the Executive Director of the South Dakota Municipal League. We too rise in support of HB 1245, which introduces a transformative approach to community development rooted in local control. This legislation ensures that residents have the ability to directly influence the prioritization and funding of essential projects without incurring any debt. HB 1245 exemplifies fiscal responsibility by utilizing the pay-as-you-go system, which eliminates the need for interest payments and ensures that every dollar raised is spent solely on projects approved by the voters. This approach not only avoids costly debt, but also guarantees that funds are used efficiently, increasing the impact of every investment. Most importantly, it upholds the principles of transparency and accountability, allowing communities to clearly see how their money is being allocated. Representative Jameson spoke to the process in which the CAPS program would be required. This inclusive process not only encourages civic participation, but also fosters a sense of ownership and unity among residents as they actively contribute to shaping their communities' futures. Additionally, HB 1245 offers municipalities the flexibility to pursue a range of projects, each carefully evaluated and approved by the public. This process guarantees that resources are allocated where they are most needed, addressing the most critical issues and enhancing local infrastructure in a way that reflects the values and needs of each community. As municipal leaders who work directly with challenges and opportunities faced by local governments, we believe that this legislation is a vital step towards fostering sustainable growth and resilience. This initiative puts decision-making power in the hands of the people, ensuring that residents can shape their community's future while promoting sound fiscal management. In short, if HB 1245 were in place, it would ensure that residents have the final say on whether proposed projects move forward, making it the purest form of local control. We urge you to support the passage of HB 1245 by standing behind local control, ensuring voter approval, and providing a debt-free financing option. This initiative empowers municipalities across the state of South Dakota to create vibrant and thriving communities for years to come. Thank you.
Thank you. Further proponent testimony. Proponent testimony of House Bill 1245. If you'd go ahead and turn on the mic. Yeah, get the green light on. Awesome, thank you.
First timer. So a little nervous, but super excited to do this. Good morning, Mr. Chair and members of the committee. I felt like it was important for myself to come up and represent this because when I was listening to the House floor, the conversation about how it
If you'd go ahead and introduce yourself, too.
I am sorry.
That's okay. Don't worry about it. Don't worry about it.
I'm supposed to follow the rules, and I didn't.
No, it's okay.
My name is Ashley Geigel, and I am here on behalf of the Murdo Area Economic Development in support of this bill. So back to with the House, I had heard a lot of conversation about how, there was a focus on larger communities, and I felt it was important that rural steps in and represents here as well. So as you may or may not know, Murdo is a small community, population less than 500. And we do not have the luxury of large tax bases, rapid growth, or excess cash reserves. When we talk about building a community center, expanding access to childcare, or constructing a modern EMS facility, we aren't talking about nice-to-have projects. We're talking about essential infrastructure that directly affects workforce participation, public safety, and the long-term viability of our community. This legislation gives communities like Murdo a practical voter-driven financing tool. It allows us to take proposals directly to our residents and ask them if they want to invest in their town for our future. That is the control at the most basic level. If approved by the voters, this mechanism would allow Murdo to propose to our residents the opportunity to construct a combined community center, childcare facility, and EMS building without issuing large amounts of long-term general obligation debt. That matters. Long-term debt ties the hands of future councils, restricts flexibility, and places a multi-decade burden on property taxpayers in a very small community. For towns with limited valuation, even a modest project can translate into a disproportionate tax base. Under this bill, the funding approach is more transparent and more contained. It is time limited, it is purpose specific, and most importantly, it is approved directly by the people who will pay for it. Who pay for it will use it. From a community sustainability standpoint, the benefits are straightforward. First, childcare. Employers in rural South Dakota consistently identify lack of childcare as a top barrier to workforce participation, and that is true in Murdo. If parents cannot find safe, reliable childcare, they cannot work full-time. A dedicated childcare component within the facility strengthens our labor force and supports existing business. Second, EMS. In a rural area, response times are measured in miles, not minutes. A modern EMS facility improves recruitment and retention of volunteer and professional responders. It enhances public safety and makes Murdo a more secure place to live and invest. Third, community space. A community center is not just a building. It is where meetings happen, youth activities take place, seniors gather, civic life is sustained. That civic infrastructure is part of what keeps small towns going. This bill does not mandate anything. It does not require a community to build a project. It simply gives us the option to ask our voters for permission to move forward in a fiscally responsible way. If Murdo's citizens do not support it, it doesn't happen. If they do, we gain the ability to meet critical needs without placing an expensive, long-term debt on the backs of a small property tax base. On behalf of the Murdo Area Economic Development and all small and rural communities, I respectfully ask for your support in this bill. Thank you.
Thank you. Nice job. Hope to have you back sometime on other bills. Further proponent testimony on House Bill 1245. Proponent testimony.
Good morning, Mr. Chairman, members of the committee. Ryan Budmeyer, President and CEO of the South Dakota Chamber of Commerce and Industry. We rise in support of HB 1245. As most of you know, I'm new to this role. But I know how hard the folks, and give them credit for how hard they work to put this common sense measure together that empowers local communities with flexible tools. We like this because it's local decision making and approval for local projects with appropriate safeguards that will help the taxpayers. From our perspective, strong infrastructure is the backbone of a vibrant economy. HB 1245 provides communities with a voluntary tool to build and maintain that backbone, all while respecting taxpayer input and promoting fiscal responsibility. We urge your support. Thank you.
Thank you. Further proponent testimony. House Bill 1245.
Good morning, Mr. Chair, members of the committee. Mitch Rave with Greater Sioux Falls Chamber of Commerce. I don't think I've ever been in this committee yet this year, so it's very exciting for me. We'd urge your support of the bill and echo the comments of the previous speakers. This can really be transformative for a lot of our communities, especially our rural ones who may not have the financial ability today to do some of the projects that they desperately need to do. This really puts another tool in the toolbox for them, and we'd urge your support. Thank you.
Thank you. For the proponent testimony.
Good morning, Mr. Chair, members of the committee. Matt Krogman, representing the Brookings Economic Development Corporation. You've heard all the safeguards that the developers of this bill have put in to protect taxpayers. I won't spend time repeating that. Would appreciate your support on House Bill 1245. Thank you.
Thank you. For the proponent testimony. House Bill 1245.
Good morning, Mr. Chair and members of the committee. My name is Nancy Hoynes. I'm the Executive Director and registered lobbyist for the American Council of Engineering Companies. Our 33 member firms work across the state daily and partner with these communities on the projects that help improve the health, safety, and welfare of their communities. And not only do we design those projects, but we're typically out there working with them, trying to find the funding to make these projects reality as well. We work in a variety of states that do have similar funding mechanisms, and it's successful there when those communities are not paying unnecessary interest and some of the other expenses that go along with other funding sources. It helps their dollars go farther and be more successful in accomplishing the projects with those communities. So with that in mind, we rise in support of this bill and ask you to do the same. Thank you.
Thank you. Further proponent testimony for House Bill 1245. Proponent testimony. Seeing none, we will go to the remote participants. Mr. Tim, are you online? There you are. If you could unmute and introduce yourself, please.
Thank you, Mr. Chair. Can you hear me?
Yes, we can.
Yeah, thank you, Mr. Chair, members of the Senate Local Government Committee. My name is Rob Tim. I'm the Government Affairs Director for the City of Box Elder and their registered lobbyists. I come before you today in support of House Bill 1245. 1245 is a straightforward, sensible process that engages the public in the most fundamental element of our democracy. 21 years ago, Box Elder lost nearly 85% of its sales tax base with the closure of Exit 66 and with the truck stop and various businesses there. That closure was a result of the state's efforts to mitigate any future issues that could push the closure of Ellsworth Air Force Base. For 21 years, we've been working hard to get back that sales tax base. Fast forward to today, our efforts to attract new businesses is slowly materializing. This has included two new truck stops, fast food restaurants, hotels, and a few others primarily located along Interstate 90. The announcement of the B-21 mission was helpful, but Box Elder still lags behind comparable sized communities across the state in sales tax revenues. House Bill 1245 would offer the city of Box Elder a tool to facilitate capital improvement projects driven by and for the community. It would focus efforts that enhance the quality of life of our service members at Ellsworth Air Force Base who either live on or off base and their families, as well as other community members. It would also allow us to capture that. It would allow us to capture that sales taxes from many of our out-of-town friends who come to the Black Hills. 1245 is a prudent, common sense approach powered by the simple concept of self-governance. It allows the people to decide what public project they want to support. It allows the people to decide if they want to be taxed. Bottom line, many legislators in both chambers talk about local control when they're back in their home districts. Yet when they come to the Capitol, that seems to be somewhat gets forgotten. House Bill 1245 is truly local control as it's meant to be. I urge you to pass House Bill 1245. Give the people another tool to help improve their communities. Thank you, Mr. Chair and members of the committee.
Thank you. Ms. Rolog, if you go ahead and introduce yourself.
Good morning, Mr. Chair and members of the committee. My name is Brooke Rolog. I'm the Executive Director for the Madison Area Development Corporation, and I'm here representing myself. I appreciate the opportunity to provide testimony in support of this legislation. At its core, as you've heard, the bill is about local control and local decisions. South Dakota communities are not a one-size-fits-all. This legislation is designed to complement unique needs of each community, and it respects that reality by allowing municipalities and the communities to walk in lockstep if they so choose. Importantly, it's not a mandate, and it simply provides an option, and buy-in matters. Community projects shape communities for decades. It gives municipalities, again, in lockstep with those community members, to be proactive, to put a path forward. Often the times we're reacting when systems fail or we've lost ways to move forward. This is a strong, well-planned community strengthening not only our local economies, rural and in the bigger hubs, but really as a state as a whole. So in closing, I'm going to just state that this truly empowers our communities. So I appreciate your consideration and your time, and I respectfully urge you to support this bill.
Thank you. Mr. Von Eye, if you could unmute. Thank you. Please introduce yourself.
Hello, thank you, Mr. Chairman. Heath Von Eye with the City of Harrisburg. I serve as the Deputy City Administrator and City Engineer here in Harrisburg, South Dakota. I appreciate the time here today to speak with the committee, testifying on behalf of this bill. I thank the sponsor for tirelessly working on the efforts for the function of what this bill would help us carry out. And also just take a second to thank this committee and all your time at the legislature this year. I know it gets to be a daunting task, and I appreciate the dedication each of you put into the work that you do for our state. I'm here today to offer probably a little more unique perspective on this bill. I've spent nearly a quarter century now working as a licensed professional engineer, much of that time in the state of South Dakota working for different municipalities. But I did spend nearly 7 years working out in Gillette, Wyoming, our conservative neighbors to the west. If there were a more conservative state than South Dakota, I would venture to bet that we would all categorize Wyoming as being one of them. And lo and behold, they have a very, I wouldn't even call it similar, they have a much more liberal version of this third penny sales tax that they called it. And what they did out there is it was simply a vote of the people to pass this third penny sales tax to fund public infrastructure projects. Where our bill goes and drills down into a much more conservative way is that Wyoming's bill or their ability to apply the sales tax was not based on project-specific details. It did not sunset after a project was funded. It did not take 60% of the vote to pass that third penny ability. What theirs was the community blanketly voted on it every 3 years. And if it's approved, the city then collects those revenues and they pour that into the community with public infrastructure improvements. Being the city engineer out there, we got to manage all those projects, and I still distinctively remember the logo they used, the Power of a Penny logo. It was a construction yellow, bright silhouette Lincoln picture of a penny, and it was the power of a penny, and that was used that way to help educate the public on what their third penny was going for. And oftentimes it was neighborhood reconstruct projects, it was park improvement projects, it was a remarkable outdoor aquatic center that they constructed, a softball, baseball diamond complex that was built to serve the community and the surrounding region, to the point to where colleges actually use that facility for softball tournaments, which of course drives its own economic development in that fashion. The other facts about their program is that it did have to be revoted on every 3 years. And the interesting fact about Gillette, Wyoming, the citizens there, they reapproved it every 3 years. They saw the value in what they were getting for that third penny. And to my knowledge, it's never been denied by the voters. It's been reauthorized every 3 years. It was during my duration there, and I believe that's true to today and even prior to my time there. So fast forward to today, how does this impact South Dakota, our communities, particularly the city of Harrisburg? Taxes are a dirty word. We all know that. It's hard to fund things that are needed in our communities. I echoed or quoted Dave Ramsey in the House committee when I testified for this bill, and the fact that borrowers are slave to the lender. And in South Dakota, as a city engineer, oftentimes to carry out the important infrastructure projects that we need, whether it be water, sewer, streets, we're having to go to bonding. We're having to go to get an SRF loan. We're having to put future generations into debt to pay for these infrastructure needs, which has been spoken to by previous testimony. But if we could offer a tool in the toolbox that help us more progressively, proactively fund critical infrastructure projects without having to incur that debt, I think that alone speaks volumes to a benefit of a program like this. So I'll pause and stand by for any questions anybody might have. And again, I appreciate the time.
Thank you. Mr. Pritchett, are you available? If you please unmute and introduce yourself. You're going to have to unmute, please. There you go. Now we got it.
Sorry.
Thank you, Chairman Reed and committee members. My name is Sean Pritchett. I serve as Director of Finance for the City of Sioux Falls, and I'm also a registered lobbyist, and I'm here to testify in support. My purpose here is to really provide you some real-life examples of the impact that a program like this would have for projects that we've done in our community. But a little more than a decade ago, the residents of our community voted in favor of constructing a new event center here in Sioux Falls. And if we'd had an option like the CAPS program that would be available through this legislation, instead of borrowing for that project, we would have saved our taxpayers $53 million in interest and issuance costs. And we could have redeployed $175 million from our capital budget over 20 years to address other capital needs like roads, bridges, police vehicles, and fire stations. And we would have saved at that time in 2012, in just 26 months, enough savings to be able to pay for it outright. I'll give you another more recent example. 7 years ago, it became very apparent that we needed to replace our public safety training facilities. Our gun range was in terrible shape. Our burn tower was condemned, and so the city prioritized the construction of a new public safety training campus here in the community, which also included a 911 dispatch center. Again, if we'd had a program like this, we would have saved our taxpayers $18 million in interest and issuance costs. We could have been able to redeploy $68 million over 20 years for other capital needs, as I mentioned before. And we could have saved enough to pay for the entire construction of that campus in just 9 months, which is less time than it took to design the campus itself. CAPS proposal is an option. It's a tool for our local taxpayers where they can decide what is most financially prudent and responsible for their community. I appreciate your consideration of this proposal, and I'll stand by and be available if there are any questions. Thank you.
Thank you. I think that's all we have for online testimony. Again, we're on proponent testimony. Is there anybody else in the room? Seeing none, we'll move on to opponent testimony. Opponent testimony on House Bill 1245. Welcome.
Good morning, Mr. Chair, members of the committee. My name is Brandy Eckert. I'm an employee with Department of Revenue. I'm here before you today in opposition of House Bill 1245. Our concerns with the bill is it raises some practical questions regarding the refund process. Currently, the department works with retailers on refund requests and then settles those amounts with municipalities. HB 1245 shifts full responsibility for refunds to the department, but does not provide a statutory mechanism for DOR to recover the refunded taxes previously distributed to cities. If a municipality's capital outlay funds are fully obligated, it is unclear how reimbursement to the state would occur, particularly given the 3-year statute of limitations for refund claims. From an administrative perspective, DOR will incur upfront programming costs because the department must be prepared for any municipality to adopt the new tax. The system updates would need to be implemented statewide, even if only a limited number of cities ultimately choose to impose the tax. Lastly, House Bill 1245 may introduce additional administrative complexity for retailers. Because each municipality could adopt or discontinue the tax at different times, retailers would need to frequently update their systems to stay aligned with changing local tax requirements. This is important to keep in mind because South Dakota's remote seller law that was upheld in the Wayfair decision is based on avoiding unnecessary burdens on businesses. So please vote no on House Bill 1245. Thank you.
Further opponent testimony. Opponent testimony on House Bill 1245. Seeing none, I'll offer rebuttal. If you'd please reintroduce yourself.
Mr. Chair, members of the committee, Mike Bockerney, CEO of the Economic Development Professional Association. Just a couple of points on the comments that were made by DOR. Not sure we're really tracking on that. As somebody who owns multiple small businesses myself, it's not difficult nor challenging to alter your sales tax. There's no software update that needs to take place. It's really quite simple, at least the software that we use and other softwares that we're aware of. I just don't see that as being an issue. In terms of the first argument that was stated, not even sure really where that comes from. That's a new one. We've been talking about this now for 2 years, and I honestly just don't even feel that's valid. I think we're maybe grasping a little bit here for something that might not be there. So, other than that, I think there really wasn't a whole lot of opposition there. I think we can work through some of these issues. Again, if 35 other states can do this and figure it out in South Dakota, so can we. We've proven we can do that, and we'll make this work. I'll just stand by for questions. Thank you, Mr. Chair.
Great, thank you. I'll close the public testimony, and we'll move on to committee questions. Any questions of the committee? Senator Roll.
For Mr. Bockerney. So it's my understanding that this tax would go until you met a certain amount. Does that stop mid-month, end of the quarter, end of the year? How does that work?
Mr. Chair.
Go ahead.
Mike Bockerney, Economic Development Professional Association of South Dakota. Actually, Senator, great question. If you give me just a second, I'll pull the bill back up here. That's actually addressed in the bill itself. There's 2 times a year that this can stop, and the reason that is laid out in the 2 times per year is to ensure that we follow the streamlined sales tax rules. That was actually brought to us by the folks at SUDA.
Follow up, Mr. Chair?
Go ahead.
Okay, and then is there anything in the list of things proposed in this bill that couldn't be paid with monies from the 2% sales tax? Because I guess it was my understanding that the second penny was supposed to be the tool in the toolbox for municipalities to be able to cover those needs when we passed that in '83.
Go ahead.
Mr. Chair. I believe if I understand your question, which I believe I do, I think the answer to your question is probably no. You probably could utilize that. The city could utilize that if they wanted to. I think you're running into 2 challenges. One is just the inability for communities with that second penny to be able to afford to get this stuff done in a timely fashion, and/or the option you have here is if you utilize this new process here through this bill, you could save all of the interest expense. With the second penny option right now, I'm not aware of too many communities that are saving the dollars up front and not incurring some sort of interest expense.
Brief follow-up.
Go ahead.
But they have the ability to if they wanted to, correct?
Yeah, if you want to take debt, the municipality has the ability to do that, and many are.
I guess clarification, the 2%, they would have the ability to save some of that money if they wanted to, or they would not have the ability to?
Oh, I believe that any municipality can choose to, the governing body of that municipality can choose to do whatever they choose to with the monies that they have incoming.
Okay. Further questions from committee members? Further questions? Seeing no more questions, I'll move into discussion and/or action.
Mr. Chair.
Senator Smith.
I move to pass HB 1245.
Second.
We have a do pass motion on House Bill 1245 made by Senator Smith, seconded by Senator Duhamel. Comments on your motion?
I appreciate the representative bringing this bill forward and for all the work that's been done over the years, repeat years, to get this right. It is definitely a tool in the toolbox for municipalities. What I like about this is it's project specific here, and then it also doesn't give us fatigue, though, because there is that pause. So you're not going to be constantly here, but when the project warrants it, it will be used. And I pray that the communities, and I think they will use this judiciously. The other thing I like is that it doesn't just, it affects communities of all sizes, and I appreciate Murdo being here today, recognizing that communities' needs could be very different from a convention center the size that was done in Sioux Falls, that it could have benefited, to a daycare facility perhaps in Murdo. Very different projects, but very important in both communities for different reasons. So I appreciate that. A tool in the toolbox for these municipalities is important, and I would appreciate your yes vote.
Senator Duhamel.
Thank you, Mr. Chairman. I appreciated the comments of Heath Van Eye from Harrisburg, because in traveling to Gillette over the years, I always wondered how they had such an amazing community with so many neat amenities. And I presumed, potentially incorrectly, it was oil money or coal money. I wasn't exactly sure how they were doing it, but this really explains it. And it sounds like a great tool. It sounds a lot easier to use there. Nonetheless, this is probably the best we could do under the circumstances.
Thank you. Further comments? Further comments on the motion? Do pass.
Mr. Chair.
Senator Roll.
Well, I know I'm in the minority of the room today on this, but I've heard a lot about costly debt, and I worry about the costly debt our citizens are going to be paying when they're already struggling to pay their bills. And it seems this year we're determined to keep adding tax onto them. If the option, I guess in my opinion, if the option is between the government taking debt or citizens taking debt, I'd rather the government do it. But currently we have a 4.2% sales tax. It's scheduled to go back to 4.5% next year. We also have the 2% local municipal tax, which obviously, as I stated earlier, started at 1%, expanded to 2%. So municipalities could cover capital expenditures. Next, we also have a 1% local tax on hotels, bars, and restaurants for the local level. And then finally, this body just passed a 0.5% sales tax for counties. So I guess when we add those all together, depending on the type of business, you're at 8 or 9% sales tax just right off the bat. And I just think that's too much to ask our citizens, especially coming off record inflation, already having problems paying their bills, and our citizens actually going in debt at higher levels than we've seen in decades. So I'm going to be opposing.
Thank you. Further comments? Senator Smith.
I would just like to remind everybody that this is voluntary for the communities to do, and we're not imposing any taxes at all by voting for this bill. You're giving the opportunity for a municipality to make this decision, and it's also at a 60% threshold. So it would need overwhelming support from that community in order to do so.
Senator Nelson.
Thank you, Mr. Chair. I just want to say, with my fellow senator across the way, you are not alone. I would say I'm me too with that as well, and the fact that we are working diligently and hard to find ways to cut property taxes or cut taxes, and here we are, putting taxes on people, and yes, it can go to the voters, but again, we know that this tax is for everybody, and not everybody will show up, and I guess that is their choice. The other concern that I have is the fact that if it was capital improvements, roads, streets, things that the average citizen that we cannot do, I would be, that's the job of government. But with one of the opening statements, it was talked about daycares and walking trails and things like that. And to me, that's not government's job. That's not government's job to do those things. And also too, when you look at the history of the penny sales tax, back in 1983, I got this handout. Yeah, it was for capital improvements. And then, how many years later, 2002, the restrictions were all gone. They could be used for whatever. And I can see that this is what this is going to be done. We use the buzzword, it's capital improvements, and he will be sitting, whoever's sitting here 10 years from now, will be hearing how it needs to be expanded and used for other things. And so I will be a no on this.
Thank you. Further discussion? Senator Shane Fish.
It looks like it's one of those bills where almost everyone's going to speak on it, so I never want to be left out. But again, cities have other mechanisms for raising revenue. Like, they do collect property taxes, and they can also opt out. So if we pass this might be a way to avoid higher property tax as well. So that's just one reason I'm in support of the bill, and I would be voting yes.
Thank you. Further comments? Seeing none, I'll add a couple of things. I know a comment was made about the extra penny that's put on prepared foods and restaurants are prepared food, but hotels and liquor sales and such. And that money has a specific place where it has to go back. That actually goes back to advertising or promoting, bringing people into the city and growing the economic base so it can help everybody. I'll go back to, and it was a good discussion about what this can cost when you have a project. And we have to remember that there can be projects that are just overwhelmingly supported in the community. And I had that back when I was mayor. People wanted a rec center. And we figured out what it was going to cost, and I think of this and how much it would have lowered the cost would have been nice as we're discussing it. And we said, yep, and we had a big group, and everybody was for it. And then we said, well, how are we going to fund it? And we were going to opt out. And you know how that went, right? And it wasn't the right tax base. They had a very good point. It was not the right tax base. And everybody that said no on that turned around and said, but how about sales tax? And so it really limited us in able to get that rec center done. Now we're looking at a rec center again. This would be a great way of getting it done. Communities have to compete. They're trying to, when we talk about keeping in Murdo, South Dakota, I totally agree that, a child care center and a community center can make that community survive. And we always talk about that we need to have rural communities survive. And this is a survival tool. So with that, I will be supporting the due pass motion on House Bill 1245. We have a due pass motion on House Bill 1245 made by Senator Smith, seconded by Senator Duhamel. All those in favor will vote aye. Opposed, nay. Madam Secretary, please call the roll.
Senators Nelson,
Nay.
Roll,
No.
Shanefish,
Aye.
Smith,
Aye.
Whiff,
Aye.
Duhamel,
Aye.
Reed.
Aye.
Mr. Chair, we have 5 yeas and 2 nays.
With that, we will move the House Bill 1220. Cow. Just going to back up and start all over. House Bill 1245 will go to the floor with a due pass recommendation. We're going to have the page we have in the room, at least. Why don't you come up and introduce yourself? That's how hardworking they are, right? They're not in here, they're working. If you go ahead and introduce yourself, your high school, what's your maybe future plans, and what was your favorite part of this last 2 weeks?
My name is Levi Atkins. I go to school in Willow Lake, South Dakota. I'm a senior, and after high school I plan to go to Northern for elementary education. And my favorite part of these last 2 weeks is just learning basically how everything works and just making a bunch of new friends.
Great, thank you. If you can come up, and I don't know if you heard the question, but it's what was, besides your name and your school and what your plans are, future plans are, what was your favorite part about the last 2 weeks?
My name is Will Penfield. I'm from Lemon High School. After high school, I plan on attending the University of South Dakota to study political science, and then I plan on going to law school. And my favorite part about the last 2 weeks has been the relationships I've been able to build with my friends and the call of the house. I thought that was fun.
You're welcome.
Yeah, that's good. We know who caused that. So, and you saw a little bit of, not history, but it wasn't used very often. So glad you guys were here to experience it. I don't know if we were happy here to experience it, but glad you guys were here. Okay, we will move on to House Bill 1258. This is an act to require that a property tax bill provide access to a state website providing property tax information. I'll ask for proponent testimony for House Bill 1258.
Good morning, Greg Jameson, District 12, Sioux Falls. Thank you for your time this morning. House Bill 1258 is really a basic, simple bill. I just wanted to give you a little background about where it came from first. I was on the task force for the property tax task force, and from that we had big objectives that we were trying to find and ways to cut property taxes for homeowners in a substantial way. And the struggle through our public meetings was clear that a lot of people didn't really know what their taxes were being used for. They didn't quite understand the process and other details about it. And so this is just a little piece that came from that, and that the hope is that by adding a QR code or requiring the counties, in essence, to include a QR code that takes them directly to the state's Department of Revenue's website, where they can then drill down on their own personal property taxes and gain more information about what those taxes are being used for, who's collecting it, and all those programs available to them for property tax relief that we've created. So all it really does is it requires the county to include this QR code along with the Department of Revenue's website, so that anybody who's looking for more information can find it as easily as possible. I ask for your approval. Thank you.
Thank you. Further proponent testimony. House Bill 1258.
Good morning, Mr. Chair and members of the committee. Eric Nelson, Government Relations for AARP South Dakota, registered lobbyist. We represent the 50-plus population for South Dakota with our nearly 100,000 members from across the state. We ask you to support the bill. AARP South Dakota followed the property tax summer study this year, has worked with Representative Jameson on a number of property tax-related bills similar to this bill before you, kind of making it easier and more transparent for your constituents, our members, to view their property taxes. If there's any doubt in your minds about, using a QR code and is our older population going to utilize that, I'd like to, put any fears to rest. I think what we've learned is that our society, including older South Dakotans, are very adaptive to technology. My 103-year-old grandmother reads the Argus Leader every day on her iPad, right? So we do all of our events these days by sending out postcards with QR codes on them, and we've seen no drop-off in attendance, and we do offer information and promote these types of things that our state does to inform their constituents of access to this types of information, and we also offer programs to teach our members how to use things such as QR codes. So this aligns with our policy related to kind of more access to information is the better, and we ask you to support this bill. Thank you.
Thank you. Further proponent testimony. Proponent testimony in House Bill 1258. Welcome.
Good morning again, Mr. Chair, members of the committee. Matt Krogman, representing the South Dakota Association of Realtors. Any way we can ease homeowners' ability to gather the information on the property tax that they're paying, we're in support of it. We believe that this does accomplish that, and we'd appreciate your support. Thank you.
Thank you. Further proponent testimony on House Bill 1258. Seeing none, opponent testimony. Is there any opponent testimony for House Bill 1258? With that, I'll close the public testimony. I'll waive rebuttal. Since there was no opposition, I'll close public testimony and move on to committee questions. Are there any questions? Seeing none, move on to discussion and or action.
Mr. Chair.
Senator Roll.
I would move due pass on 1258.
We have a due pass motion from Senator Roll, seconded by Senator Duhamel. Comments on your motion?
Yeah, I think it's a good idea to help our individuals or our landowners better understand the property taxes that they're paying and the value they're getting for it. And it doesn't increase the tax, so I'm very happy with it.
Got that slipped in, didn't you? Further discussion on House Bill 1258? Seeing none, we'll move on for the vote. House Bill 1258 has a due pass motion made by Senator Roll, seconded by Senator Duhamel. Those in favor will vote aye. Those opposed, nay. Madam Secretary, please call the roll.
Senators Nelson. Excused, sorry. Roll.
Aye.
Shanefish.
Aye.
Smith. Whiff.
Aye.
Duhamel.
Aye.
Reed.
Aye.
Mr. Chair, we have 6 yeas and 1 excused.
Thank you, Madam Secretary. House Bill 1258 will go to the floor with the due pass recommendation, and I want to certify that for consent. Great. Okay. So that's, we got to do this for the last time for this year for a bill. And thank you for everybody's hard work to get through all our bills. We didn't have too heavy of a bill load, but we did work through, I think, more bills than we did, I think, last year, or last session.
You are welcome.
Thank you.
Who's the new member?
It's because of the new member. That's why everything went so well. So with that, I'll entertain a motion to adjourn.
I would make such a motion.
Motion by Senator Roll, seconded by Senator Duhamel to adjourn. All those in favor will say aye.
Aye.
Opposed? No. We are adjourned.
SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder.